I'd like to call the November Operations Committee meeting to order, please. They get a motion for approval of the agenda. Mr. Akers and Mr. Perkins. All those in favor? Aye. Opposed? Carried. Can I get a motion for approval of minutes of October 19th meeting, please? Mr. Sheridan and Ms. Curran. All those in favor? Aye. Opposed? Carried. Next on the agenda is our COVID-19 update with Dr. McGuire and Dr. Williams. So I would turn it at this point, Dr. McGuire, Dr. Williams, I would turn it over to you.
Thank you, everyone. I'm going to show my slides here. Can you see them?
Yes. Yes.
Okay. So as an update for today, we have 502 cases with 11 people in the hospital. We are following 63 as active cases in isolation. 423 went through the isolation. And as we mentioned last week, we now have had our fifth death. And if you look at these numbers, last week during this meeting, we were at 424. So from last Monday, we have seen 78 new cases. You can see that we're almost doubled with those that we are monitoring actively. And the hospitalizations have increased as well. When we look at the cases that we see on a weekly basis, this shows here again that we are continuing to rise. This week, by the weeks we go for monitoring, which is Wednesday to Tuesday, we have seen, and so we're just at, we still have one more day in that week. We have seen 68 cases. When you look at the daily average of cases, we're now up just close to 10 cases per day that we see. And I put that red line there that really shows that like even in September, we had a high day and that was more around 3 cases. And when you look at this rise here in the fall, as compared to what we saw in the spring, we are on a trend that's much higher than when we saw just when the response just first started. If you compare the cases that you see the first 7 days of the month, with October being last month, you can see that we've had mainly 1 case per day. We had 1 day where there was no cases. And so for that first week of October, there was just 6 cases. Now for the first week of the month of this month, we are at 60 cases. So this really just points out the rise that we're seeing. For the whole month of October, we saw just 84 cases. Now, so far this month, we're at 93, and that's so far. We're at the 9th day of this month. Here is what we have for the isolation and quarantine process. So we currently have just 73 people, and that includes those who are in the hospital, and 600 or just over 600 in the active mandatory quarantine. So those are the people who have been exposed to a positive case. If you look at how this compares, this graph is one that I showed at the end of the September time. You can see the rise we have seen in the active cases, so 5 versus the 73. And those in the active mandatory quarantine. The precautionary quarantine that has stayed mainly stable, those are the travelers. This month so far, we have had to put out these exposure notices. So from places like restaurants, stores, churches, and even some of the buses that do travel through the county, there have been some of the like the exposure. So really now we're just getting to a place where there's not many areas that you can go to that you can be safe just from like an exposure. For last Tuesday, so that everyone could vote, and that includes people who were in the isolation and the quarantine process. We worked hard on just making sure that that people had the application for the absentee ballot. We made sure that we could get their ballot to them once that was just received, and then that their ballot could be then just gotten by the polling place. On the 3rd, though, we also did put in place just a drive-up option for those that were in isolation or the quarantine process, so they could come here to the building and still do the vote and not have to stand just in line at all of the polling places. With the rise in cases that we've seen this week, doing the contact tracing, there have been many times that there were exposures due to the polling places. So we did try to put some of the measures in place, but because people had been tested or didn't know, those kind of windows might have been on the 3rd. The main transmission pathways that we're seeing are through like family members. So people getting tested and then just some of the other family members just becoming sick. We're seeing a lot in work contacts. And so that's why it's really important just to understand that just when you, when you're with your family or when you're at work, it's just really important to be aware of what exposures you have. And in the last week, we have seen just a lot of like parties and like gatherings. And so we're still seeing the effects of the holiday last weekend. So by this weekend, with it being the 14 days, we should see, but we have seen a rise just to the activities that have occurred last weekend. So with us moving forward to the Thanksgiving holiday and the Christmas holiday, where these types of activities, just like getting together with our families, are things that happen often, we are going to see just more cases. So it's really important to be thinking about, what you're going to do for the holidays and what kind of modifications just can be made. We do have a lot of the connections to cases, but not all, and the spread is wide just through the whole county. I always list the testing sites. We are getting more of the rapid tests. Those test results aren't always as kind of clear cut as we'd like them. Just many times they do have to be followed up with a PCR test that gets just sent out to a lab. And sometimes they're not being sent to our office, so we don't learn about the results just as kind of quickly yet. And all of the testing sites have just been really busy. I always go through this, and it's really important that we wear a mask, and it's important that we wear it just in the way that we should, that both our mouth and the nose can be covered. And so just remember, there's lots of ways that we see people wearing masks that aren't going to keep us safe. It's important to do social distancing, wash your hands. And I mentioned very frequently that's important to stay home when you're sick. And I think sometimes we all forget what the symptoms are, and it can be very mild. But here is the list. And so if you're feeling one of these, you should be staying home from work or from school and just be kind of, thinking about whether you should be going out. And as we always mention, staying local is important. We're seeing this rise just through the state and through the nation. And that's what I have for an update. And I think Dr. Williams was going to make a few comments as well. Thank you.
Thanks, Dana. So I wanted to kind of reinforce some of what Dana said and just point out that, as you can see from her presentation, unfortunately, St. Lawrence County has had a rapid increase in the number of COVID-19 cases just in the past several weeks. After a summer and early fall where we were doing quite well, this is a dramatic change. This dramatic rise in cases, I think, really threatens the significant gains that we've made as we've worked to reopen the economy. We've opened the schools, and we've had kind of reached a new normal. I also point out that, as we know, many people in our community have made significant sacrifices since the start of the pandemic to ensure the health and safety of our citizens. So I really feel like we need to take this opportunity to reset and to regain the ground that we've lost in the last few weeks. And to reiterate what Dana said and what we've been saying at these meetings, that really the best way for us to do this is for the community to fully embrace the 5 pillars of prevention: wearing the mask, washing hands, physical distancing, staying home when sick, and staying local. And I think if we do this, our community can control the spread of the virus. We can keep our economy going, we can keep our schools in session, and we can keep our community and religious organizations thriving, which I think are shared goals throughout the community. But this is our opportunity to reset, going into a tough time with the winter and people needing to be indoors. We have winter holidays coming up where I know we all want to get together with our families, but we need to do this in a safe way. If we don't take this opportunity to reset now, it's going to be a really tough winter that none of us want to face. So those are my comments for tonight.
Thank you, Dr. Williams. Legislator, how are you?
Both Dr. McGuire and Dr. Williams, I hung on every word for the last how many months I've been here, and I trust your professionalism and your expertise. This weekend and this week, I've had a much closer experience with COVID than I've had sitting on this Zoom meeting. I'm going to tell you anecdotally my experience, and then maybe you can tell me if this is the case generally, what the problem might be. Is it just my bad luck? It's hard to get a COVID test, okay? The Potsdam location closes at 3 o'clock. They're not open on the weekends. I know positive cases that have never heard from any contact tracing people ever. And so consequently, that turned into 4 cases very close to my family. My general practitioner has the wrong number to call. So I, of course, went on the website and got the right number. So I feel like between the medical community, I don't know anything about the other testing sites other than the one up here, 49 Lawrence Avenue, which is in Legislator Haggard, or Fiacco, excuse me, district. But as a personal experience, my hair's on fire. I don't know whether that's an outlier or what is going on, but I have access to good insurance. I have access to all the things that make my life privileged. Many of us don't. I don't understand. I was told, well, we can run it through your insurance and you can have the test in 2 days, or we can run a free test and you'll have to wait 4 or 5 days. And if you're not positive, we're not even going to call you. Well, one of the people one of the people I do know who was positive never got a call. He went into the patient portal on St. Lawrence Health System and found out for himself. So please explain to me, tell me that this is an outlier experience, or what are the problems? What are the problems that people can't get tested? There's no contact tracing for these people, and there's a lack of communication all the way around. Thank you.
So I'll go ahead and answer sort of the questions about testing as best I can, and then I'll turn it over to Dana in terms of the contact tracing. So I wish I could honestly tell you that this is the only time I've heard that people have had difficulty getting testing. What I will tell you is that despite Herculean efforts on the part of the medical community and both Claxton, Hepburn, and St. Lawrence Health System, as well as some of our private partners, I think everybody's worked very hard to make testing as available as possible, to have the most accurate tests, and to have a clear system of communication. However, what you just described does happen. I imagine every legislator on this call has heard a similar story. I do think the majority of people are able to get a test and are able to get results in a reasonable period of time, but there are definitely situations where that doesn't happen. As far as the weekend, St. Lawrence Health System does have testing on the weekend at the Lawrence Ave site. It's sort of managed by the urgent care staff. So I'm not sure about what happened with the communication there, but there is testing available on the weekend. I will also point out, and I do not mean this as an excuse, but maybe just an explanation, that sometime in late October, I think we were doing well as a community with the virus. I think the hospital systems were kind of getting the swing of things. We got more resources from the state. And then the malware that infected the St. Lawrence Health System really kind of added a kind of chaos that was not expected. And I think systems that were up and running reasonably smoothly were derailed. And I don't know how much your experience is a reflection of that. Again, it's not an excuse, it's just an explanation since that's what you're asking for. What I can tell you is that everyone in the medical community recognizes that testing is a key part of our response, and we'll continue to work to make the process as smooth as possible, as affordable as possible, to make sure the communication is there. And I guess I would just apologize for the the bad experience that you had, but also thank you for bringing it up, because as with any other situation, the only way we get better is when we understand where we're not doing well. And so we'll certainly take your comments to heart, and we'll continue to work to improve. And I would put that out there to all the legislators. I think many people do contact me about testing. If there are obstacles that people run into, we don't want those obstacles to be there. Sometimes we don't realize they're there. So please continue to explain the experiences that you've had. If they're good experiences, that's lovely. If they're bad experience, that's helpful. So Dana, I don't know if you want to talk about that.
Legislator Quack.
Thank you. Could either the doctors or possibly even Ruth maybe touch upon what the state of emergency for our county, what the citizens might expect to change in their everyday lives?
Chairman, if I can answer that?
Go right ahead, Ruth. Thank
Okay.
you.
So the state of emergency was enacted with the review and conversation with the state. And what it does at this point in time is renews the efforts we put into place to bring front and center the importance of social distancing and mask compliance. It certainly has gotten the attention of the public relative to the dramatic increase in cases. We are seeing, as Dana indicated, and certainly Dr. Williams mentioned, such a dramatic increase in such a short period of time. We had allowed the state of emergency that we had extended in April and in March and in April to elapse as numbers decreased and demand relaxed a bit relative to what we were seeing for cases. So now that landscape is changing, and we want to be able to respond accordingly. So in that way, the state of emergency itself serves to gain the attention of the public, to remind folks of the 5 pillars that were brought forward again this evening, as they are most weeks. And it allows us in the future, if additional measures are necessary, to act under that state of emergency through emergency orders, if that becomes necessary. I hope that's helpful, Tony.
It is. Thank you. And I appreciate you moving in that direction for the safety of the citizens of our county. Thank you.
Absolutely.
Point of order. Dr. McGuire had a response to Mrs. Becker.
So
Yes.
with regard to the case investigation and contact tracing, there's been a few things at play. With the hospital system being down, we don't get test results quite as kind of quickly as we were. We're not alerted to them in the same way that we were. And so that kind of, the communication kind of changed. We are always very close with the labs. And so we still get that. It's a little bit more challenging. With the rise that we had so quickly, we had like 25 to 30 cases to be doing investigations on. And so while we get to the cases, it does take us longer. It might not be on day 1, it might be day 2. We do try to make contact with each one of the cases when we're not going to be able to do the full investigation, to let them know that we know of their results. We're going to be contacting them. We do provide them a form to just list out their contacts. So when we do call them back, they're kind of aware of what their time span was, who they're going to mention, what that contact information will be. But we've also had a lot of cases, and this has to do with how the labs, when the system was down, is we don't get addresses, we don't get phone numbers. And so all of this takes a little bit more time to just get a hold of people. We've had wrong phone numbers. We've had people not answering the phone. And so I would say that if there's anyone that you know about that has tested positive, that's been told we're going to contact them and they have not heard, to please call our our office, because we always make contact, but there are things that are not going on because of this rise. With regard to contact tracing, you can see that the rise for people who are in the mandatory quarantine has skyrocketed. So we're now over 600 people. And so each case we're seeing now has more and more contacts. And really, we're kind of seeing that due to the gathering, because there's more kind of things going on. You know, we have school cases, things like that. So we have to think about the classroom, we have to think about the bus, and trying to get all of that information does take time. And so all of those things are kind of in place. We also use kind of the virtual team from New York State. So we pass some of those contacts to them. So not all of the contact tracing is kind of happening right in our office. And so we are trying to manage that load. But if there is somebody who thinks that they're a case or that they're a contact and they have not heard from us, please just call our office. We are working just as fast as we can.
I could make
Dr. Williams.
just one follow-up comment on that. The CDC recently released information about what was happening in the state of Delaware as an example of how community mitigation was positively impacting their response to the virus. And in reading it, if I'm reading it correctly, it says that the median time to contact to do case identification was between 6 and 8 days. So that is not the standard that we use here. And I think Dana and her team have, I don't want to say spoiled the community, because they've really just done their job in an excellent way. What we expect is that people get contacted, we'd love for people to get contacted in 6 to 8 minutes. Realistically, that doesn't happen, but her team has done a really good job this whole pandemic in contacting people probably faster than in any, in many other places, I would say. And as she said, just with this overwhelming number of cases, I think things got slowed down. And then with a malware happening at the same time, we were just in a really awful position.
And I can just see with the increase that we're having, it's going to slow down. I mean, we just have, and we have more and more people that are kind of joining our staff, but it's just, there's just so much to it. And there's a coordination piece and trying to get the information in a timely fashion too, takes time. So that kind of adds to that as well.
My question had no lack of confidence in either of you. Okay. It was a personal experience that, I'm sorry, Mr. Chairman, I didn't ask you if I could speak, but I just want to point that out again. I'm bringing it to the board and to you too in particular, because it was a personal experience I hope nobody else is having. Has no reflection on how hard your staff works. That's all.
I would like to add that with this increase, we're not able to do the work like we were doing it. So this is the first time that we go home at night and there's some things that we need to catch up on the next day. Like we can't do it all in one day. And one of the major things that we're seeing is that people are not really giving us the full story. So we hear through some of the other contacts or from a school or from somebody that something happened, and then we get more contacts. And it's not our office to judge any of the activities. We are here to try to contain it. And if we don't know that information, we can't do that. And that happens, quite frequently.
Mr. Burke.
Dana or Dr. Wams, given the current trends in the data that you reported, what are your projections? And the second part of that question, what is our level of preparedness based on those projections, and what resources are needed?
I don't have numbers in mind, but if we continue on the rise that we currently are, we had activities a week ago from the holiday that we're seeing now. This increase started before that. As we go into Thanksgiving and into Christmas, this is going to be worse. So I don't know, Dr. Williams, do you have an idea of the numbers?
Yeah, I mean, so I guess one of my bad characteristics is I'm a perpetual optimist. I really truly feel that if people in the next week to come can embrace the 5 pillars of prevention, take this seriously, stop the mixed messaging, et cetera, I actually think as a community, we've proven that we can control the spread of this virus. So I don't think it's, there's nothing inevitable about things getting worse. I think if we do nothing, clearly things will get worse and probably a lot worse. But I think if people take this seriously and re-engage, there's room for optimism. It's not going to go away, but it may be manageable. And again, I think the goal should be to make it manageable enough that we can keep doing what everyone wants to do, which is have an economy that functions, be able to see our relatives and things like that. As far as resources or readiness, I can speak for the hospitals that, as I think I mentioned before, we have not sent any of our troops home. We anticipated this, and so both St. Lawrence Health System and Claxton, I think, have a lot of resources on hand to meet the need. Now, same conversation as in the spring. Though we are more prepared than we were in March, there are limitations. And if things get very much out of control, there's not limitless ICU beds, then there certainly aren't limitless, doctors, nurses, nurse practitioners, PAs to person those beds. So I can tell you that we're already re-expanding our COVID unit at St. Lawrence Health System in response to the surge of cases. We still have capacity, but if people don't make these important changes, at some point we're at risk.
Go ahead, Mr. Burke.
In some of your previous discussions, Dr. Williams, I think you talked about the possibility of exponential growth, and that and I think you may have mentioned that one person can conceivably infect, I can't remember how many you said, but I guess I'm wondering, with what is currently happening, what is a realistic projection? And I realize what you said about the preventive measures that we can all take, but it kind of sounds like the cat's out of the bag here. And I guess I'm just wondering, trying to ascertain our best estimate and our level of from the county perspective. Do we have all the resources we need? And if not, how can we get them?
So I don't think I'd be comfortable giving a numerical estimate of where cases will go. But as you brought up, what you see with this virus, as with other viruses, is they can sort of have this exponential phase of spread. And looking at the numbers, if you were a mathematician, you would notice that there's kind of a snowball for us non-mathematicians. Once the virus picks up momentum, it tends to spread rapidly. People talk about the R value, which is the reproductive value for, initially we thought that every person who's infected, about 3.5 other people become infected. That number's reported at all kinds of different levels, but that's a rough estimate. And I would say the cat is not entirely out of the bag. I'd say we still have its tail, and I'm a cat person, so I say that in kindness to cats. I really do honestly believe we still have the opportunity to turn this around. I think the next week or two we'll know whether we're doing that or not.
Thank you.
Mr. Sheridan.
Mr. Chairman, I'd like to direct these questions to both Dr. McGuire and Dr. Williams. There's been an uptick recently in the news the last day or so on reports that the Pfizer vaccine results are clearly a step forward. There's one headline. The other headline is Pfizer says its coronavirus vaccine is 90% effective. And I was just trying to see if I could get an idea of, from what you are hearing on your level with dealing with health officials, do you have any idea or sense of when this vaccine may start to be able to be available for the public based on all the news from Pfizer recently in the last couple of days?
So I don't believe any of us are aware of a fixed date of when we're going to have access to the vaccine. What we're, I think, hearing in different sectors of the medical and pharmaceutical communities is that they're anticipating that it will be released. They're anticipating some logistical issues. I think I mentioned the need for refrigeration at a very low temperature. As far as the information that was made public today, I think all of us are very excited to hear about it. It's basically Pfizer has their vaccine, which is in phase 3 trials. They released what they're calling their second interim report, which demonstrated that of the 96 people who became infected in their study with COVID-19, 90% of them were not vaccinated. Only 10% of people who were vaccinated were positive. And I should also point out that the report that they released was a press release. It wasn't a scientific paper yet, just because that's the nature of how quickly this is moving. So I think a lot of us in the medical community would like to see the actual research that they're publishing. But again, it's very exciting. It seems like it's effective. They're not having any new reports of safety concern, but it is what's considered preliminary data, and there's no, release date that's really clear. But we're all, excited and anticipating getting the vaccine at some point in the community.
And from the Department of Health side of things, we are starting to prepare to receive vaccines. So we don't know yet they haven't said which vaccine. So this is new information since our last meeting. we are starting to get ready for what we would need to accept that vaccine and start to plan for a pod, which is how we would do that distribution to the community.
Could I have a follow-up question, Mr. Chairman?
Go ahead.
Dr. Williams, you mentioned phase 3. How many phases are there that we have to wait for?
So typically after phase 3, if it's successful, they release the pharmaceutical or the vaccine. So once they're done with the different components of phase 3, they will release the vaccine. And then there's some people consider it phase 4, where you monitor for safety, been released to the community. So they're in the, it's technically the final phase before they release it. It's just, I think what they're reporting now is that they've demonstrated immunity for up to 7 days after the second shot of the vaccine. And this is so hot off the press. If I'm saying something that's contradicted by the subsequent releases, please forgive me. But that's my understanding, is basically there's 2 vaccines, there's 2 shots in the series. And what they're reporting is that they're confident that at 7 days after the second shot, 90% of people are immune, which is better than what was expected. But it's just it's very preliminary.
So, thank you, Chairman. So is this the messenger RNA vaccine that they had talked about? Is that the formulation?
It is. It's a messenger RNA vaccine, as is one of the other ones that's likely to come to market.
Okay. And I guess my second question is, I know we have a lot of people that are very concerned about this emergency order, and some of them came here tonight. I don't know that you can see them from your vantage point, but I think what they're worried about is how this is going to change school openings, kids going to class. Is this going to, do you foresee a shutdown? These are, I think, the things people are looking to have answers to. And short of recognizing some of the people that have questions, I just wondered if we had any comment on that.
So at this time, I don't believe that it's going to change the schools. We're going to keep in contact with the districts so that we're all on the same page with where just the pieces. One of the things that we provide to the schools is just how many people, whether they're a case or someone who is in quarantine, if they're a student or a staff member, because that's the thing we have to watch. If we get too many people who can't function just to do the job, that's where the problem becomes.
And I don't want to speak for Ruth or the county leadership, but to me this is an effort to, like I said, to continue all the things that we've gained, all the amazing progress we've made in terms of the economy and in terms of opening the schools. To me, I think this is an effort to make those things continue, not to try and shut them all down. But I'll also say, if we are unable to turn things around, then I imagine there's going to have to be other measures taken. But this is our opportunity to reset things in order to keep the economy going, in order to keep all these things happening, but happening in a safe way, with the 5 pillars of prevention at the forefront.
Thank you, Doctor. Thank you, Dr. Williams, Dr. McGuire. Ruth, do you have anything that you'd like to add?
I would just certainly reiterate what was spoken with regard to the state of emergency. The actions that are mentioned by Legislator Curran were taken by the governor in his executive orders. Those were not taken at the county level. There were no closures specific to businesses or to schools as a result of emergency orders out of our state of emergency. Ours was more in concurrence with actions that were taken. We saw numbers through the summer that identified an opportunity for us to allow the state of emergency to lapse. And the numbers we're seeing just this last week are enough that we need to get the public's attention, and we need to make sure that people are diligent about the efforts to slow the spread of this virus. We do not still know enough about how it behaves to prevent the spread. So the efforts, I think, are to get the attention of the public, to make sure that everybody remains diligent. And if we all have stepped back our efforts a little bit, to renew those efforts and really work hard to make sure those cases don't spread and we get those numbers on the daily cases back down.
Thank you, Ruth. Legislator Akers.
Thank you, Mr. Denisha. Dr. Williams, you mentioned that we had 11 hospitalizations. What are the number of beds between, say, Orange Health Systems and Claxton and maybe Governor and Messina for that are specifically designed and set aside for this COVID?
So I think if you look at all the beds that are what I would consider to be readily available, we're looking at something like 40.
Thank you.
Yeah.
Does anyone else have any questions or comments for Legislator Hager?
Thank you, Chairman, for letting me double dip. This question would be, I think, for Mrs. Doyle primarily. Do we have flexibility, should Dr. McGuire and Dr. Williams say, now we know we need this to happen? Do we have the flexibility to get the people we need in a timely manner, even though we don't have a number? I love Dr. Williams. I want him around when I really get sick. He's the biggest optimist in the world. I'm probably the opposite. I just want to know that we can react if they do need those people.
Absolutely. And I think certainly that's a concern. Just looking at the numbers and the efforts that public health is trying to make on a daily basis. We still have some other department staff helping out on the contact tracing front. I will be talking a little bit later under County Administrator's report about some options that I'd like the board to consider with regard to some flexibility that you've already provided to me. I'd like to look at an option to expand upon that a little bit because I think we do need some more flexibility, and we do need a little bit higher level of expertise with the volume that we're seeing now.
Thank you very much.
Is there anyone who has not had an opportunity to speak or ask a question that would like to do so? Okay, I guess I will take this opportunity then. Dr. Williams, Dr. McGuire, I received a phone call this morning from one of my constituents regarding the protocol for reporting results back to folks that have been tested. And again, this is anecdotal evidence, but apparently this particular person was told that if you haven't heard anything back from us within a couple of days, assume that it's negative. I cannot believe that that's anyone would say that, but I guess I need your take on it. So
I'll make a comment on Dana. They may want to make a comment. But I feel very strongly, and I always have professionally practicing medicine. I always tell my patients, you know, there's the expression, no news is, and then of course everyone says good news. And I always correct them and I say, the way I practice medicine and the way I expect our hospitals to practice is that no news is no news. And people should expect to hear a result. Hopefully it's a result that's negative. If it's positive, they need to hear that too. So the standard throughout the medical community is that people should be hearing about their test results, including a negative. Now, again, this sort of malware issue has really thrown a wrench in the works, and so I can't, vouch for what someone said in that context. But again, both systems are set up very much so that people should be getting their test results, whether they're negative or positive, because for peace of mind. And we want to make sure that people do get that information. So So that's certainly not intentional. Intent is for everybody to get their results, negative or positive.
Thank you very much. And thank you for all that, both of you are doing and your staffs, and yeah, thank you for the support.
You're welcome.
Moving on, Sheriff, Big Ward. Would you like to give us an update on the plan?
Absolutely. So good evening, everyone. Thank you for having me here to talk about this important executive order that we have to fulfill. Before I get started, you're probably looking at the sheriff saying he looks a little scruffy. Sadly, we have an officer in our road patrol that's battling cancer right now. And we want to do some things for him. One thing we developed was growing beards in November and paying so much per week to do that, and then giving those funds to him and his family in this difficult time. So I obviously want to lead the charge on that. And I didn't grow a very good beard, probably not like Jim can, but it's a sad time. So if you see me here with a beard and some of our officers, it's for a good cause, and we usually don't let them grow beards, but we're thinking about this individual and we're praying for him. So if you see the beards out there, you'll know why. Okay. Secondly, I want to introduce my team. This police reform is quite the executive order to fulfill. Confident that we can do it. We're very close to doing it, but I couldn't do it without some people behind me. The Undersheriff Sean O'Brien is sitting here, and Sergeant Filiatra is here also. Sean really does a lot of policies and procedures, which police reform is a lot about. And Sergeant Filiatra is our accreditation officer, manager. And again, that part is a big part of police reform. So at the end, if you have any questions for them, or if I have to ask them to clarify certain things, I invite them along. So other than that, we're ready to start. Go ahead, Dylan. Next slide, please. So Chairman Lightfoot and Legislator Perkins have seen some of these slides. I've added some different ones, and we'll talk about our stakeholders group. So I apologize to them because some of this is going to be repeated, but for the full board and anybody that's out there Zooming or on YouTube, this is kind of what we're going to talk about, our police reform, what we've done, what we've accomplished, and what we need to do. And I'm going to just briefly go over the 4 steps like I did in the past when I came in, just to briefly go through what it takes to pass this reform. But I did see this quote when I was doing some research on this. And anybody that knows in law enforcement, Sir Robert Repeal is kind of the father of law enforcement back in the early 1800s. He started developing law enforcement and agencies, and he had 10 principles that he developed. He was the first one. And this was number 2. And I read this and I said, wow, this is pretty apropos for this police reform. You know, if you can't read it, I'll read it for you. The ability of the police to perform their duties is dependent upon public approval of police existence, actions, behaviors, and the ability of the police to secure and maintain public respect. And that gentleman said that in 1829. Now that statement to me doesn't hold any more, you know, it holds more truth now than probably then, but he was way ahead of the curve on what it really takes for people in the public to respect law enforcement. So I think Executive Order 203 from the state is really summed up by this quote, and I thought it was a pretty good quote. And this came back in 1829. It still holds true today. Next, Dylan. So I'm not going to go through every side of your work because we'll be here until midnight, and my fiance will probably not be home later on tonight because she won't want to be that late. So I'm going to try to go through these quickly as possible, but it is important to know certain things. All this is the police executive reform order from the governor. And the more important thing on the bottom is the most important part of this slide is that we can improve. We can always improve. Police agencies, whatever business you're in, whatever you run, it doesn't hurt to review your policies, your procedures, to better yourselves. And that's really what this executive order, it doesn't have to be a negative thing, it can be a positive thing. It's made us really look through a lot of our things, change a few things, find out that a lot of things that are in this order we've already been doing. So it doesn't have to be negative, it can be positive. Next. And I'm not going to go too far into this because when I came July 13th, I gave you the steps that it would take, so I'm just going to briefly go over these. Step number 1, the county must perform a comprehensive review of the Sheriff's Office employment strategies, policies, procedures, and practices. And we talked about this on July 13th. Next. The second step, the Chief Executive Officer, who is Mr. Lightfoot, the Chairman of the Board, is tasked to call together the Sheriff and the stakeholders in the community, develop a plan for any needed improvements to current employment strategies, policies, procedures, and practices. And I can tell you we have a stakeholders group, and I'll tell you who's on this group in a few more slides. It kind of was a broad brush type thing across community and businesses and schooling and some other areas. We already had 2 meetings and they were lengthy, and I did go over both on my time frame. So I thank those people that really put a lot of time into this. We had a meeting October 13th and on October 21st, and they both were very productive meetings. Next. So step 3 is a plan shall be offered for public comment, and we kind of already done quasi this in our second stakeholders meeting on October 21st, where we opened it up to Zoom people, anybody that wanted to come in from the public, or they could write a letter, email, whatever way they could correspond. We did some of that. But what we're going to do is do a public hearing December 21st. I've already talked to Chairman Lightfoot. We've kind of set this up where we have a public hearing on the 21st and let the public speak on this. And then obviously we have to have this adopted by the April 1st, and we're in pretty good shape right now. Next. So step 4 is pretty simple. After the resolution is passed by this board, it's sent to the director of budget, and they review it, and then it's adopted by them. So a 4-step process. We're really in step 2 right now. Step 3 would be the public hearing and the resolution in front of you. And then step 4 is pretty simple, just to get it down to the folks in Albany. Next. So when we went for planning on this, there's 3 components, and I read the 120-page executive order from Governor Cuomo and the legislators from down there. And they focused on 3 areas: education, training, and supervision. And then they had some bullet points that through the reading that I developed. They really focused on your use of force policies, bias awareness training, de-escalation training and practices, your policies and procedures, and then they really are pushing accreditation, and we'll talk about all 5 of these bullet points. Next. So the Sheriff's Department has a mission statement, and I'll read it to you because it's pretty important. It's longer than this, but this is kind of the paragraph that sums it up. The St. Lawrence County Sheriff's Office serves the law enforcement needs of all the citizens of the county and strive to do so in a professional manner, respecting the rights of all our citizens without regard to race, color, nationality, creed, gender, or sexual orientation. Our policies and procedures are developed and carried out with that goal in mind, and our 33 deputy sheriffs are selected, trained, supervised to complete this mission statement. And we wholeheartedly support that mission statement. Next. Just to review, part of the police reform is your deployment of your office. That's part of what you have to explain. I could be here until next year explaining everything we do at the Sheriff's Office. So I've kind of put it down to 4 slides here on how we operate. We have a very big county in this state. It's the biggest one in this state, and it's the 5th largest this side of Mississippi. Some people think it's the 1st. It's not. It's the 5th. There's 4 bigger ones in Maine, but it's a very big county. So we try to break our deployment into zones, and each officer is assigned a zone. And obviously that's for response times. We strive to assign the deputies to where they live, but we want them to know the whole county, so we kind of spread around once in a while. Another thing that talked about in police reform is quotas. We do not have quotas. That was a whole page on quotas on police reform. We strive to have contacts. We educate the public. I, as sheriff, have never pushed tickets. I'm not a big ticket guy. I'm more of an educational guy, trying to educate the public, slow people down. Obviously, we want safety first when people are operating vehicles or we're arresting people is our main focus. But we don't have quotas. We're not looking to write so many tickets. It's all about the education. It's all about the safety of the citizens of St. Lawrence County. Next. For those that can see this map, it's going to pop up here, hopefully, in a second. Dylan, if you want to go to the next one. There you go. So a lot of you guys probably can't see that from here, but there are, if you see the color codes, that's our different zones, 1, 2, 3, 4, and 5. Number 1 is in the middle, it's kind of the Canton-Potsdam area. The one on the right, we call the Route 56 corridor. The one on the top left is the River District. And zone 4 down near Mr. Denisha and the gang down there is zone 4, that we call that the Badlands. And if you ask me why we call it the Badlands, I don't know. I've been doing this job for 34 years. I walked in the door and they called it the Badlands, and I blame it on legislator Denisha. So let's go with that. Yes, he's got the, for whatever reason, it was the Badlands back then. I don't know why, it kind of stuck, but it's a great area to see. I tell you, I was down in the Tully Pond Road 2 days ago, and I saw 5 waterfalls, and it was, I've been in this county my whole life and never had visited it. And I knew the Tully Pond had some things down there, but it's amazing to see. I was like, wow, in this county, I didn't know it was sitting there. I definitely think anybody that hasn't been there should be there, but it was one heck of a day to go for a walk, and it was awe-inspiring. So we've got those places in this county. Next. Again, a deployment. About a couple years ago, I was undersheriff. I thought our school safety initiative needed to revamp. So we got together with some of our supervisors, came up with a plan to get our deputies into the schools. We're not there to discipline, we're more there for safety. We wanted our officers in the schools for many reasons. Number 1, for safety, as I said. Number 2 is to be familiar with students. We didn't want students seeing officers walking in and go, wow, what's going on, officers sitting here. We wanted them to be familiar with officers, know that we're there to help them, not hurt them. We wanted to get to know the staff, the administration, the superintendents. So if something did occur, we had some contacts there. We wanted to get a layout of the schools, all the egresses, the exits, the hallways, the rooms. So if we did have to go in an emergency situation, deputies weren't going in there not knowing where the band room was or the lunchroom. We wanted them to really be familiar with the layout of each school. And we have those in our computer. So if we are called to the school, the schematics are right on the computers, so the officers can punch them right up on their way there to trying to figure things out. And then 2019, we had 478 school checks. I don't know what we have this year with COVID. I don't think we've been there as much, obviously, with the COVID issue. Although I did talk to the superintendent, I talked to Mr. Tom Burns, the head of BOCES, and the schools still do want us into the schools. But with COVID, we've kind of scaled back a little bit. But it's pretty important for our deployment of our deputies is to be involved with the school safety initiative. Next. We also have to deal with social services. Part of the police reform was a big push on social services, how police departments were interacting. I could tell you in our office that we assist them with pickup orders. If a judge deems someone that needs some mental services, they have what we call a pickup order under the mental health law. We go assist the mental health workers with pickup orders, not frequently, but at certain times. We deal with substance abuse calls, we deal with homeless, assisting them with placement, transportation, and we deal a lot with custody disputes. So we already are dealing with social services, and we have a very good relationship with them. Next. We have a detective deployment. This is another police reform. They kind of wanted to talk about what your detectives do. We have 4 detectives, 1 detective sergeant that kind of runs the whole detective division. We have 3 detectives that are broken into 3 different zones, and they handle the major crimes, any felonies, assist with bad traffic acts and fatals, all those things. We have 1 detective that's assigned just for the drug task force. But as I said to this group before, it's kind of one big detective unit. One week they could be 3 guys working on a drug task force issue, and the next week you got all 5 guys working on a kidnapping. So we kind of want to revamp how our detective division was, and we've done that over the last couple of years to get really more bang for your buck. But we have a great detective division and a great drug task force division, so they're doing an awesome job. Next. And this map just shows you the zones of the detectives. As you can see that the Badlands is pretty big, and the River District and Route 56. It's more populated area. If you're saying, wow, that's a big area down there, it's less populated. I can tell you I was the detective 17 years for the blue section, and that is our most busy sector in our county. Next. So a big part of police reform, when you read the 120-page book, was community contacts. And I know that's small print for you guys to see, so I'm gonna kind of talk about this. And when we started looking at what we do for the community, we found out we do quite a bit for the community. As you can see, these bullet points are all the things we do, and I didn't list everything we do, but kind of the things that are the positive community contacts that we have with our police department, or excuse me, our citizens. And the first one, you probably can't read that, but it's a business check contact check card that we started. And I know Mr. Lightfoot, Mr. Perkins have seen this, but if you all want to turn around here and look at this card, it's pretty important. We started this program at the beginning of the year, Sean, and we went to a sheriff's school, a new sheriff's school. We didn't invent this, but some other counties in the state do this. What this is a business check card. And we check a lot of businesses at night, and probably they don't know we check a lot of businesses at night in camps and some residences. When people go away, they'll ask us to keep an eye on their places. What we have developed is this card for any businesses or residents that want to check. We'll go and check their businesses. And we'll leave this card letting them know that we checked their business. And there's a notation part, like if they left a window open or a back door open that maybe they didn't know about, we'll let them know. Listen, you left your back door open, or your side window was unlocked and you didn't know it. And we've gotten quite a few responses from people calling that, man, this is one heck of a program, that you guys are out there checking buildings and letting us know and helping the communities out. It's pretty successful, and we like it. We think it's well overdue, and we should be doing this. This is something at night or even during the day that we should be doing. So we do this quite a bit. The officers go out and patrol. They got a stack. They check businesses, residences, and it doesn't matter if they find an open window or don't. They put this in their door and saying that we're looking out for you folks. And we've got a lot of good response that the community really likes to see this, and we definitely will continue this. So that's out there. Obviously with meth labs, and we're having issues with that, we all know that. That identification part, we always tell people, don't touch these things. We have officers trained to touch this, to identify it. So we go out in the communities and do that all the time. We teach a fire police course. Actually, Sergeant Pilatra is our instructor. So we help the fire departments get trained in that course. We have, I could be here until midnight talking about inmate programs. I'm not going to go that far. The one big part, I think, is we have some substance abuse programs in there that we're trying to get this inmates involved with, so when they do get out, they don't repeat crimes, but we don't want to see them back. We started this year with your resolution, pistol permit safety classes. Obviously with COVID, we've kind of shut that down, but once we get past this, we'll definitely start it back up. It's pretty important to the public. We got a lot of responses on that, a lot of people that called and want to go through this course. And obviously we want people out there, if they're going to handle handguns, to be safe with them. And it's called a safety course for a reason. We want people to be safe. We do many safety traffic initiatives. A lot of it's grant funded, stop DWI, seatbelt checks, all those things. We're doing those frequently. We have a boat patrol. We're the only boat patrol in the whole county, believe it or not. It's a pretty big county, a lot of waterways. We do a lot of vessel checks. Again, we're not looking to write people tickets. We're more to educate people. You need this flotation device, or you need to do this. It's not about the tickets, it's about education and getting people safe on the waterways. We get complaints of people speeding on jet skis or whatever. We try to hit those waterways and get people slowed down, keep them safe. We have a Snowmobile Patrol, and they do the same thing. We check the trail systems, and a lot of times we're checking camps. People are gone for the winter, and we're doing safety checks on their camps all the time. We have a drug take back event where people can come and drop off their drugs to us. We dispose them. Obviously, we don't want them in our sewer systems. It's just not a good recipe. So we help them with that. Our Canine Program has canine demonstrations. They go do demonstrations at schools and VFWs. They're all over the place. They do that. We have a neighborhood watch meetings. If anybody wants to develop neighborhood watch in their areas, we've done a couple of those. We did one in Waddington early this year. Rita was there. I think it was pretty informative. We don't really have the manpower to run a neighborhood watch program, but we have a PowerPoint and give them the tools to do it. So anybody that wants to do that, we've done a couple of those this year. We're at the county fair every year with safety, and next year, hopefully it's back open. And we're talking about getting a booth there for information and safety, setting up a booth, buying a tent with our emblem on it, and trying to develop that community service to get that interaction. We go to many career days, career talks all the time at schools, colleges. We put out flyers about Halloween safety. We try to talk to the kids in school about that. I talked about the No Shade November. The summer camp, New York State Sheriff's Association has a summer camp. If you don't know about the summer camp, it's a great, great camp. What it is each county has a number of students that they send to this summer camp down in Penn Yan. It's a beautiful camp. It's on the lake, and they do so many activities. They have cabins, and you get to go down for a week. And what we do is we try to pick kids that can't afford it. The kids that will never, ever be able to go to a camp or go to a park, and they just don't have the money as their parents are struggling. We pick those kids on purpose because they're never going to get a chance to go to something like this. And we have about 30 on average from this county that go down to this camp every year. They couldn't, this year it was canceled with COVID, and there was a lot of sad faces, I can tell you. But we've been doing that for a long, long time. I used to run that program. I think the Detective Sergeant Karinji runs that now. And it's a great program, and the kids come back. I've never heard a kid maybe being homesick a little bit, but there's so many activities of canoeing and things down there. They just really enjoy it, and that's something the Sheriff's Association pays for. We buy the kids a lunch, we buy them a t-shirt, we get them on the bus, they take a bus down, everything's paid. They don't pay a thing. So it's really good for the community to see that the Sheriff's Office and the State Sheriff's Association really want to see kids that don't have a lot of money get to do some of these things. So it's a pretty good thing for the Sheriff's Office and the Sheriff's Association. We do Operation Safe Child. I think Leighton, you are in charge of that. What's the number we do probably a year, estimate?
Oh, probably 30 to 40.
Yeah. No, for the whole year, what you said?
30 to 40 events. Yeah. Probably close to 500 kids.
Yeah, so that's a pretty good service where you get their IDs and their fingerprints and get their pedigree out there in case something does happen. We have all this ready to go on a computer. If we have a Amber Alert, boom, it goes right out quick. It really helps in some investigations. We get a lot of requests for that, which we really like to do. Project Lifesaver is our brace-up program for Alzheimer's patients or anybody, young kids that are maybe wandering away. We use that quite a bit. We try not to make it a cost for people, so we try to go voluntary contributions from the public and to sustain this program. It's a great program and it saves lives, so we really like to afford the public that. The Yellow Dot Program, if you don't know what the Yellow Dot Program, it's where you can come in to our office, you get a yellow sticker, we put it on the driver's rear door, and if you ever get in an accident, you'll have your medical information in an envelope you put in your glove compartment. Let's say you're diabetic or something you need to know, and let's say you have an accident, you're unconscious. If there's a yellow dot on your nose, we know to look in the glove compartment, get that envelope out, and it tells your whole medical pedigree. The sheriffs across the state do that. It's a pretty good program. I wish more people, I don't think we have a lot in this county. We try to publicize it quite a bit. It's on the app, but it is a good program. And we need to really kind of push that a little more because I think it's important for the public to know what's out there, and it could save your life. So we have the Yellow Dot Program. So a lot of community things we do out there, and I could go on, but obviously we have a short amount of time. But a big thing with police reform is what are you doing for your community? There's 15 bullet points right there that we already do for our community. Next. So what have we accomplished to date? So the executive order came out June 12th. I can tell you June 13th I started working on it. And I've been working on it ever since with my team and myself. It's quite a bit of work, but we've done a lot of good things, and it's paid off. So the first thing we do is we met with the chiefs, the state police, the SUNY chiefs, SLU's director. We talked about what we're going to do for college when they come in the fall. We knew they were coming in. We wanted to get some plans in place of how to handle that. We had some college forum meetings. There's a group of all the college presidents, all the town supervisors and village supervisors of Canton and Potsdam, and myself and all the chiefs of police. We have a group where we get together and discuss college issues and some other things about police reform. We also had a meeting with Professor Youngblood. We had a forum on police reform back in, when was that, Sean? Quite a while ago, 3 months ago. Yeah, he had a nice forum. We had a vivid, lively discussion. We had some law enforcement officials there and professors and some other people. It was a great forum. We learned a lot, and we brought it back to the table for our stakeholder group. We've had some training and educational components, and I'm going to talk about that just a little down the line. We've achieved accreditation. I'll talk about that also, and the trainings that we completed. We'll talk about those one by one. We also had a stakeholders group, as I had mentioned, a couple meetings there with a public comment. We've since worked even more on our use of force policy, on the changes. I'm going to show you those. And then just last week, I had a forum with the St. Lawrence University students and staff on a question answer period with them. And we'll definitely continue to do that with the colleges. So we've branched out and done a lot so far. Next, Dylan, please. Just to give you a snapshot on the stakeholders group, and I apologize for these slides if you can't see them. Again, we had to come up with this group. Some were mandated by the executive order to be on there, and then specifically they didn't say that you exactly have to have this, this, and this, but we thought it was pretty important to have a broad brush of the community. So on the stakeholders group, if we can ever get there, I don't know if you heard me, Dylan, if you want to go to the next one, please. It's hard doing this on Zoom. There it is. And I don't imagine anybody can see that from there. So I'll read them off to you. So there was myself, the undersheriff, Sergeant Filatra. We had Tracy Barnes, who is a mental health counselor. She's great. I don't know if you know Tracy Barnes. She's one of the nicest persons you ever meet, but she really is learned in her field of mental health. And she, during the stakeholders meetings, has some great ideas and some great input. I really have to thank her. She really stepped up. She was one of the first ones when police reform came out and emailed me and said, I want to be on the stakeholders group, and we made it happen, obviously. We had the BOCES superintendent, Tom Burns, on the stakeholders group. Obviously, he has a wealth of knowledge in the educational field. Dave Bush from Transitional Living Services. We had our chaplain, Father Carrera, was on the stakeholders group. Mr. Lightfoot has to be on the group. The public defender, James Gahan, he also has to be mandated to be on the group. I had two individuals from the 4 People Campaign of North Country, Corey McGrath and Romita Pillay, I don't want to mispronounce her name. The district attorney was on the stakeholder group, and he's mandated. Again, Mr. Perkins was on the group. Keith Sapp, who is a board member at Potsdam Central. Jennifer Stevenson is a business person in real estate, and Carrie Tracy was our probation representative. And again, Professor Youngblood was there. He gave us great input. So we had a really broad brush across the county and this is really what the executive order talked about, having some business people and some education people and some legislators and the DA. That's kind of the people that suggested be on that stakeholders group. Next, Dylan. So one of the big things about police reform is accreditation, and the governor's really pushing this, and I know the Sheriff's Association is pushing this, and I push it myself. I'm a big believer in accreditation. 2/3 of the sheriff's office in the state are accredited. It's not an easy task. It is very difficult. You could probably look at Sergeant Filatra. If he didn't have his mask on, he'd be saying, yup, it's a lot of work. And I give him a lot of credit because he's the man for the job. He's very organized and meticulous, and I knew when I picked him that it was the right man. But he can tell you the hours and hours and hours that he put into this. But I think it's very important. And little did I know police reform was going to, because this started 1.5 years ago, little did I know it would really help with police reform, although you should do it anyway. It checks so many boxes with police reform, accreditation. And it's a continuation. It just doesn't happen and you're done with it. But it started back in '84 and the Sheriff's Association started it. And it's been great ever since. Next, Dylan. So it's an internal yearly review. And I think they can walk in at any time, right? They can just walk in any accredited agency. They can have a visitor from state people that accredit you. They just walk in any day and say, we want to look at your books. It's not like they're going to tell you, okay, you got 2 months, we're going to look at your books. They can walk in anytime and look at your books. And so that really keeps you on your toes, which they should. You should have it tight. So we've been accredited. It happened September 3rd. We were really, really happy about it. Again, I give more credit to the two over there than me. They're the guys behind the curtain that were really doing most of the work. But they did an awesome job. It took a lot, and we're very, very proud of it. And these guys should be. They did a lot of work. And you get accredited, recredited every 5 years. But again, there's an internal audit yearly that you have to go through. And the thing about accreditation, it doesn't just set standards, it exceeds them. I can tell you all these standards exceed most of the executive order. So again, it checks a lot of our boxes, and it really gives you the template of what you should be. I can tell you that the governor is big in accreditation. I am not going to be surprised in a couple years that everybody's going to be required to be accredited. I see it coming on the horizon. I can't tell you for sure, but I believe it's going to happen. I can tell you that Canton PD is accredited, SUNY Canton is accredited, and ourselves. Those are the only 3 in our county. Now, we've offered assistance to any police agencies in this county that want to get accredited. I've got one of the best men you could ever ask for advice or to help them do it. And we've offered it, and I don't know if they're going to take it, but if they do, we'll be more than glad to help them get there because it's very, very important. Okay, next, Dylan. So I'm not going to go through this use of force too much because there's like 6 slides. I just want to kind of make you understand that we reviewed our policies and procedures, and part of accreditation was reviewing your use of force policies. And we did do that, and there's a couple of changes coming up I'll show you. So go to the next one, Dylan, please. Keep going. Sorry about that. Yep, so top red, it's in little print. It's the chokehold obstruction, breathing circulation. This is what we have changed recently. Our revision of the use of force policy, that is the executive order. I'll show you briefly later that this was already enacted into law. But I'll read it to you because it's kind of important. Any application of pressure to the throat, windpipe, neck, or blocking of the mouth or nose of a person in a manner that may hinder breathing, reduce intake of air, or obstruct blood circulation is prohibited unless deadly force is authorized. And that came right from DCJS. Am I correct on that? Undersheriff? Right from the DCS. And DCJS, for those that don't know, that is our state agency that really tells you what you need for policies and procedures. So that was their verbiage. This is the one big change that we put in our use of force policy. Next, Dylan. Next one too, till you get to a red one, if you would. So it's gonna be like 6 slides. I'm sorry about that. I should have deleted these. Right there. So, this part of our use of force is the new revision about getting mental or medical attention to anybody in our custody. I'm not going to read every single word, but that's in a nutshell what this is about. And that also was mandated by law. So that had to be changed in our use of force revision. Go ahead, Dylan. Keep going until you get to procedural justice. If you can hear me. Thank you. So a couple procedural things that were in the executive order that we already are doing. And again, we were doing many of these things already. Policy standard number 3, officials shall not express any prejudice concerning race, religion, politics, national origin, lifestyle, or any personal characteristics. Goes on to say when any person applies for assistance, advice, or makes a complaint, whether by telephone or in person, all pertinent information will be obtained in an official and courteous manner. We already do that, but that's part of executive order. Next one, Dylan. This is, says officers shall courteously and promptly record any writing any complaints. This was another part of reform, is about how do you handle citizen complaints. We have no transparency. It's a priority with us. Any complaints that are made have to go to our duty supervisor or sergeant, and then he forwards it to our administrator, which is the undersheriff, handles all these complaints. And then if any further investigation is conducted by myself or him, and if it has criminal activity, then we involve the district attorney. He's then consulted and brought in. And then another part of police reform, Attorney General will notify any unarmed suspect shootings, which is, we already do that anyway. Next, Dylan. So number 7, the county recognizes the importance of maintaining an atmosphere of openness, cooperation with the community. We've been doing this also. Our big thing when we took over this year was to get our sheriff app up on board. And I said this before and I'll say it again, our use of force policy is right on our sheriff app for anybody in the public to read and see. It's right there. We have a notification banner to get anything out to the public. We have a good Facebook page. We have an officer that works on that, does a great job with it. We send out a lot of media releases, and I, as sheriff and the undersheriff, will tell you that we have an open door policy. I have people already set up to come in the next couple weeks to talk to me about. I got one individual call me today about the Constitution. He wants to talk about the Constitution. He wants to come in and talk about, his group has some concerns about the Constitution and want to talk to the sheriff about it. Okay, come on in. So we're setting a meeting up to do that. I get them all the time. I have an open door policy. I always tell people, I will talk to you. You may not like what I say, but I will talk to you. Next, Dylan. De-escalation is another part of police reform. I'm not gonna read all this again, but our stakeholder group talked a lot about this. It was pretty important. Our verbal education and how we handle things verbally instead of physically is always the way we wanna go, and we do stress that. What we have in our department is what we call verbal judo. I'm an instructor, Chief Murray's an instructor. It's kind of an 8-step thing on how to handle something verbally instead of use of force. You get that in the academy, but we haven't really had a refresher on that or really an in-service. So that's gonna be one of our featured bullet points for next year, is to have a verbal judo training refresher for our officers. Next, Dylan. Another big part of police reform is body cams, and you've probably seen this nationwide, but it's one of the big executive orders. I can tell you this, the state police next year, I think it's in the spring, they're gonna be mandated to have body cams. Any patrol officer in uniform for the state police next year is gonna have a body cam, mandated. And the cost of that is about $31 million. So, but that's already been enacted, and the governor, it's already been signed, so they will have body cams. Potsdam Police has had body cams for a couple years. Canton PD is in the process of buying body cams. They've already approved it through their board. I think SUNY Canton has body cams, and obviously we're looking into this strongly. And I am a proponent of body cameras. It does many, many things. So we had a trial based on October 1st. We've had them since then, and I can tell you we've used them 3 or 4 times to better out things already in 1 month. They're very advantageous in many, many, many respects. They're not cheap. I'm not going to sit here and tell you they're cheap. They are expensive, but what you can look at a lot of surveys, and what you spend today saving on lawsuits tomorrow is immense. I mean, lawsuits out there could be 100,000 up to 500 to $1 million that you could have an issue with, and body cams have proven that it reduces your lawsuits. Not that should be the reason that you go to body cams, but it is part of it. So we did some calculations on a sheriff and my secretary, Cora Bear, who I hadn't mentioned. She's behind the scenes with our police reform too. I want to give her a shout out. She is instrumental in our day-to-day operation, and she's been great on police reform. I couldn't live without her. I call myself a colonel, the guy on MASH that doesn't know much. She's my radar to Colonel Blake all the time. She really keeps me on my toes. She's great. She knows things I need to do before I know if I need to do them, so that's great to have. But anyway, we did a lot of cost analysis, and we're with a vendor for about $60,000, correct? Correct. And that'll man all of our officers. So I'm going to come to you guys in January, talk to the county administrator, and I'm going to bring forth a resolution in January to get this done. We got, what, 4 or 5 right now we're testing out? 4. And they've just been great. I'll talk, next slide, go ahead, Dylan. I'll kind of tell you what they do, because I've been very generalized in it. Obviously, they show transparency and accountability, and that's what we're all about, especially police reform. It collects a lot of data. We retain that data. There's documentation right there for anything that occurs. It helps confirm the nature of an event and supports account articulated. I can tell you without getting too specific, we had an incident a couple weeks ago. I won't say where or who was involved. One individual said that he had many officers pointing guns at him. And we were like, wow, didn't know about that, didn't hear about that. Luckily, one of our officers that we are doing a trial basis on had a body cam. So we reviewed body cam. No officers had any guns pointed at anybody. None. You know, if you say a book is worth 1,000 words, I think a camera's worth 1,000,000. So right there, I was like, wow, and it's been a couple, 3 incidents that have happened that we just go to the camera. So to me, it's worth it. Evidence purposes in a crime, you have it right on camera. The example of DWI, you know, the sobriety tests, the on camera, those type of things, but other serious ones, obviously. If we have any use of force issues, they're wearing a camera, we can go to the camera. We get a complaint, let's go to the camera. It just really helps in a lot of these issues. It helps you get quicker resolutions on civilian complaints and the training opportunities. I know we had one instance where we had a felony stop out on Route 11, and we had some officers, one had a body cam, and if you do a felony stop, now we get too much into the weeds, but really only one officer is supposed to give commands. It gets too confusing if you get two guys talking to these people, and there was an instance a couple of times where two officers were talking over each other. Well, guess what? That's gonna be a good training tool. Next time we do in-service, we're gonna show that and say, listen, when you do a felony stop, one guy does the commands, everybody else doesn't. Those are training opportunities we can see on our body cams. So there's 8 bullet points here that are very important that I think body cams are the way to go. Next, Dylan. Part of police reform also is your evaluation of your officers. We've been doing this for a long time. They get a yearly evaluation. Every time we, through accreditation, we have to give them a copy of our mission statement so they understand our professionality, ethics, all those things that need to be done. We always give them positive, what they're doing right, but we also say, listen, these are the things you can improve on. And throughout the year, we check on those improvements. We set goals for accreditation. We have to set 3 or 4 goals in the beginning of the year, and we try to strive to meet those goals. So we're always evaluating not only our officers, but our office in a whole and our policies and procedures, always under evaluation. Next, Dylan. When we got to the stakeholders group, and this is where Tracy Barnes and some others really came up with some good ideas about the officer's wellness. Because if you have a broken officer out there, or an officer that's stressed out, there could be issues, right? We don't want that. We want officers that are not having the issues out there working. They have to deal with a lot of stress out there. A police officer I always say this, a police officer is always dealing with everybody's problems. We don't get calls because they're having a good day. We get calls because they're having a bad day, and they want our help. And that sometimes it's stressful on officers to listen to someone's problems over and over again. Now, they accept that. They hired on, they know what they're getting into. But that being said, they're still stressing the job. And I think the stakeholder group, I think Mr. Perkins will agree, they were talking about our wellness of our officers. And it's important that we're looking out for them also. And so going forward, and we do this already with our EAP, there's crisis intervention and counseling. But one thing they did talk about is having our sergeants trained, to talk to our officers after they have a stressful event. It could be a fatality, it could be a use of force, something that's maybe a fatality with a young child. That hurts. I've been through those things, and notifying someone they lost a loved one. That's the toughest thing in this job. I've done this 34 years. I'd rather do anything else but do a death notification. Anything. Let me tell you, your heart pounds big time. It's stressful. And we got to recognize that. So I think the stakeholders group really came with a good idea to make sure our sergeants are really, debriefing our officers when they have an event and being trained in that. And that's what we're going to do. We're going to get them trained. It's very important. We started a chaplaincy program this year. We got 2 great, Father Chris and Father Shane are great guys. They love law enforcement. They're just one of those, they're just into law enforcement, and they've come into our groups and done our in-service, and they're going to continue to do that, and they're an avenue for our officers to reach out to, and they do an awesome job. So that's already there, but I've talked to Father Chris, and he's going to do some more training and help us out on being less stressful. And we change, we're cognizant of people have issues, and we change their shifts sometimes to help them out in their family life and things like that. And again, the mental training. Go ahead, Dylan. I'm going to skip through these quickly. These are just laws. I know I've got a long time, but they're just laws that they've already passed. Repeal of 58, you may have heard about it, if you haven't. That's a law that's out there that the public now has access to certain records of our officers, and that was passed on June 11th, 2020. And we have already researched that and talked about that with the county attorney and put a plan in place. Next, Dylan. Next is the Misconduct Investigation Office. This is in the planning stages. This is something happening in Albany where they're developing an office of investigation. So I really can't tell you how this is going to look so much as a broad brush of saying they're going to have their own investigative unit. It's still in the planning stages. Next, Dylan. And it's supposed to be enacted by April 1st. So I really can't tell you exactly specifics on that other than they have an investigative office and they're going to have more specific information as it goes. The next one, Dylan, is I already talked about the Nhl Act that passed June 12th. If you remember back our use of force, the red part, this fulfills the Nhl Act, that you have to put in your policies and procedures. And next, on top of that, we've also had training with our defensive tactics and educating on this new Nhl Act. So that's already been done, trained and educated and incorporated in our defensive tactics, which you've already done, right, Sean? Okay. The next one, Dylan, is the Police Statistics Transparency Act. It's kind of a records keeping act. Part of this is for the courts, part of it's for the district attorney's office, and part of it's for us. And that goes into effect December 12th, and we've already started preparing for that. Next, Dylan. Reporting police officers' discharge of weapons. This one we already do for accreditation. We've been doing it. The second bullet point, I told the stakeholders group that I don't agree with this. It says verbal report to supervisors within 6 hours and a written report within 48 hours. I can guarantee you my officers aren't going to wait 6 hours before they report a shooting. I have no idea why that is there. None. Especially with your radios and communication with cell phones. It's not going to take anybody 6 hours, but that's the way it's written in there. But we will not do that. We will do it as soon as possible. We have been doing that. Next, Dylan. I spoke about the right to medical and mental health. Again, that was already incorporated, and you saw it was in our policy procedures on our use of force policy. Next, Dylan. And this is our implementation phase, what we're going to get into in the future that I've already discussed. Again, the body cams coming forward with a resolution in January. The wellness training we're going to get for our sergeants and Father Chris coming in and helping. Obviously, we're always going to have more training on mental health, de-escalation, verbal judo, more community interaction. That was a big one for our stakeholders, what we're going to do in the future. We didn't want this to be a one-off with police reform. And myself and the undersheriff are already going to do this. We're already going to plan on town hall meetings. We kind of got that from our new sheriff group too, where some of the sheriffs go around to their counties and they have town hall meetings with certain areas. We're kind of going to break it up into 4 different regions. Maybe one in Edwards, where all the community from Edwards to Star Lake to Governor area, the Badlands again, Mr. Venetia. But kind of have a town hall meeting, not just about, we were going to do this before police reform, any issues that you had in your area that you wanted to talk to the sheriff about, you could. It didn't have to be police reform. It could be something else in the community that you wanted to address me or the undersheriff about. We were already going to do this. We were going to go around and do town halls. I know Mr. Lightfoot wants to join us next year and go with us. Any legislators that want to. But once COVID calms down, hopefully sooner than later, we will be doing these town hall meetings. And I'm sure police reform will be on the front burner, and we'll keep the conversations and any improvements that we need to make, we'll keep going. But we plan on doing those town hall meetings. So that's our way of keeping police reform on the front burner for the citizens of the county. Policy procedure review, again, that's accreditation. You have to review your policy procedures yearly. That's going to continue. And one of the things that came out of the stakeholders meeting was on our website. We didn't really recognize it because it's a daily thing for us. But it was a lot of arrest people and a lot of news releases. And it didn't have enough of the positives that we do. Maybe talking about the Yellow Dot program or the county fair coming up, we'll have a booth. Those type of things we want on our app to get out there because it's not all, negative things. The sheriff's office does a lot of positive things, and I showed you some of them on that slide. And we want to get that out there that it's just not all negative. We're out there to help people, and the bottom line is we're out there to serve the citizens of St. Lawrence County. And we want to know that we're there to help them and to serve them. So that's part of the things that we got out of the stakeholders group. And the stakeholders were great. We got some good ideas and good input. And you can see by this PowerPoint, I'm not bragging, but we've done a lot. We really have. We've checked a lot of the boxes. We went through this police reform, Under Sheriff myself read page by page. I highlighted things. I was, my due diligence, and I really put forth the effort I think that needed to be taken. It's an important subject, and again, we can approve. It's a positive, not a negative, and going forward.
There are 6 police cars down on Newark Avenue for something.
Maybe that's the time when it's done. So with that, the next slide is questions. So I know that's Mr. Nichols, it sounds like to me.
It does. It does.
So, thank you. Mr. Denisha, any questions that we more glad to ask?
Legislator Akers.
Sheriff, on your meetings with the stakeholders, what was the biggest differences? Was there any disagreement about was there any contentious issue?
No, not really. I think the topics were that our office and the county as a whole has been doing a good job already. Obviously, there's a few things that need to be adjusted, but from what Mr. Lightfoot can talk on this a little more, but I thought there was a good input and some different perspectives from different people, and a couple things I'm like, hey, that's a very good idea. I didn't think of that, and that was why you bring these people in, because I can't think of everything, and I know I'm good, but I'm not that good. And the undersheriff's the same way. We will take input, and we did, and but again, accreditation really helped us immensely, and my work with my people behind me, going page by page, literally page by page of the executive order, which is 120 pages, and highlighting, we do this already. We don't do this, let's change this, let's look at our policy here. We really put, since June 13th, a lot of time and effort into this, because it is an important topic. It's something that I took very seriously, and I think I should, as the elected law enforcement of the county. I think the sheriff should be the forefront on police reform, and I try to assist the PDs. They have to do their own municipalities and their own meetings and things, but we've worked together as a group, police chiefs and myself, to come up with these reforms. But the brethren I got was that we're already pretty much doing a lot of these things, but there's some improvement we could make, and I think we came to concessions that these were the things that you saw the things going forward, the things we've already done that need to be done to make this successful. Yeah.
Thank you.
Yeah.
Legislator Fay.
I'd just like to say one thing that sometimes we forget about how much stress is gone. When I was a legislator back in the 80s, Sheriff Knowlton put me on a night patrol with the deputy, and when I got home.
It was with me.
You?
Yes, you rode with me. I look much different now. Much better now.
I remember there was 3 stressful incidents just in that 8-hour shift, not even talking about the things that happened, but
yep.
there was 3 of them were very stressful. And
yep.
I'm glad
that was the thing. I remember you
distinctly.
Yep. Yep.
You probably remember how scared I was in a couple.
You were white knuckling it, what you want to say.
Does anyone else have any questions for the sheriff, Under Sheriff O'Brien, or Sergeant Filiat?
I have a question for the sheriff.
Go ahead, Tony.
Thank you, Mr. Chairman. Mine's more of a comment. Sheriff Bigworth, you've been around the department for a long time, but you've been running the show for a shorter period of time, and the accomplishments that you've made, have been great in a short period of time through a pandemic and everything else that you face. But so many of the different things that in your presentation that I've known personally you've done. I mean, a lot of times people will talk about the things that should be done, but I know with a phone call, you were over in Louisville at a round table because there were thieves in the area. I asked that you give some attention to a town road that was being heavily traveled because of a bridge outage. And again, you do what you say you're going to do. You educate. Writing tickets isn't always the answer. And again, those are just a couple of examples of the many things in your presentation that I know personally you've done. So I thank you, and I commend you and your entire department for all you're doing, and keep up the good work.
Appreciate that. Thank you.
Legislator Sherman.
Yes, Sheriff, I noticed in the slide that you showed where we discussed use of force, and there was something there that made me question where does the authorization come in a situation where there's an officer one-on-one? And maybe some of the more severe cases, as opposed to what Legislator Fay was seeing that night.
Right.
Where it's a life and death situation and you're dealing with the guy or gal or whoever, that's just, it's life or death.
Right.
And he's one-on-one with this guy. And this looked to me like that clip talked about he had to get authorization to use deadly physical force.
Well,
authorization meaning is he's got to figure out how to call you, or does he have authorization before he leaves?
No.
This is the understanding.
No, great question. So in our use of force, there's this thing called in New York State penal law, Article 35. Article 35 spells out use of force for police officers and use of force for civilians. There's two separate things in Article 35. I can tell you that every year, mandated, we have to have a training on Article 35. And Detective Sergeant Cringy is our instructor. So every single year, I've been through it 34 times about Article 35 on what justifications, I could be here all day talking about Article 35, but it spells out, you can use this force if this occurs. You can use this force if this occurs. So we are always educating our officers on use of force. But you're right, a split-second decision is sometimes tough to make. It is, it's tough. I mean, you got to act sometimes in a split second. So we hopefully depend on that training, that Article 35, that we pound into their heads year after year after year of how to handle a situation. And we do defensive tactics. We do scenarios with, if this happens, how do you handle it? You know, what weapons would you, what soft techniques would you use? What weapons would you use? Or would you do verbally? So we're going through scenarios all the time. We're doing, during our use of force, we're doing that. But Article 35, it's a great question because every year they go through this and they have to understand this. You're authorized through Article 35 on certain situations to use certain force. Sometimes it's deadly physical force. If this situation happens, you can use deadly physical force. We train this year because it makes sense. Year after year, you should be trained on something because it's probably the most serious thing a police officer has to go through, right?
Yeah.
The use of force, serious physical deadly force, is the most serious thing a police officer has to deal with. So hence, you should have very good training on this, which we do. Article 35 mandated every year. I went through it 34 times. Every year I'm like, wow, I went through Article 35. There's a reason for it. And then we incorporate that into our use of force policy. And we incorporate it into our use of force training. And we incorporate it into our defensive tactic training. All of our training is really goes back to Article 35.
Right.
So great question. And so the officers know when they can use force, when they can't. But again, that split-second decision is a tough thing to do. And that's why you have shoot, don't shoot, computer, what do you call those things?
Yeah, the simulation.
There you go.
Yeah, and
You train on a simulator where you have a film where a guy comes out with a gun, and sometimes he doesn't. He comes out with a piece of paper to hold it, and it's don't shoot, shoot. I mean, we train that all the time because it's a split second. We want their minds to really start thinking about it. And that's where the stress comes in. We don't want our guys all stressed out there. You got to make decisions. And it's tough. It's a tough job, but
yeah.
We have some great officers and of all the law enforcement agencies, the whole county. I've been lucky enough to work here 34 years. I've worked at a lot of agencies, and I've been throughout the state. I can tell you, St. Lawrence County law enforcement is top notch. It really is. We have a lot of good chiefs. State police is always assisting us. They got a great organization. Border Patrol, Homeland Security helps us. It's a group effort out here. We are a huge county. We need everybody on board. And I can't say enough about all the law enforcement agencies. They're top notch. That's all I can say.
Well, thank you.
Thank you.
Legislator Haggard.
I just wanted to say thank you for letting me participate in October. If COVID ever is over, I'd be interested in going to some of these town halls that you're talking about.
Absolutely.
That'd be great. Obviously, someone needs to go along to keep an eye on Legislator Lightfoot if he's going to be at all of these. So I volunteer to do that.
You're driving, Margaret.
Legislator Reagan.
Sheriff, I just want to say, back when I was a newspaper reporter, I had the opportunity on many occasions to go out to incidents where deputies were involved. And, you know, I think sometimes the public has a misunderstanding of the great lengths that officers go to try to prevent a use of force. I can remember one time very vividly when an individual was brandishing a pistol and was inside a car, and a deputy was convinced that this individual was going to do himself harm and dove through the window and wrestled the gun out of the individual's hands in order to prevent the person from shooting themselves. And, you know, the bravery and courage shown by officers putting themselves at risk for the public is something that most of the public never sees and never realizes how often officers go into places that society would never dare to go. And I just think that law enforcement deserves a great deal of credit for the way they are constantly serving us on a daily basis, and the tales of courage and bravery that the public never hears about.
Any questions or comments for Sheriff, Under Sheriff, or Charlie Tiliatroff? Anyone hasn't spoken? Very good. Thank you, Sheriff.
Thank you.
Now on to resolutions. We have a resolution authorizing the chair to sign an extension with New York State Division of Homeland Security and Emergency Services Office of Interoperable and Emergency Communications for the fiscal year 17 Operation Stone Garden Grant. Mr. Sheridan and Mr. Akers. Go right ahead, Sheriff.
Okay, so this resolution is due to COVID, the 2017 Stone Garden Grant. The time frame from when we were going to get a vehicle was supposed to be this summer. That was the time frame we ran out. Due to COVID, the production of the vehicle was delayed. I believe that the sheriff said it's on its way. So it should be here next week. So we wanted to extend this grant where we could buy this vehicle. This is an extension of the grant. We have to have a resolution to get to the end of the year where that vehicle, instead of the county taxpayers paying it, is paid under our state Stone Garden Grant. So I need a resolution to extend that Stone Garden Grant from 2017 June to the end of the year.
Does anyone have any questions for the sheriff in regards to this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. Thank you, Sheriff.
Thank you.
And the next one, next resolution is emergency services. Matt, are you with us? He is. Okay, the first resolution is a resolution authorizing the chair to sign a contract with New York State Office of Homeland Security for fiscal year 20 emergency management performance grant. Would someone to move this resolution? Mr. Perkins and Mr. Akers. Go ahead, Matt.
Good evening, everybody. This first one is a grant to offset administrative salaries to help with the response of COVID-19.
Questions on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. The next resolution, authorizing the chair to sign a maintenance contract with Business Electronics for voice recorders in the 911 dispatch center. Mr. Perkins, Mr. Akers. Go ahead, Matt.
Well, what this one is, guys, is we do a yearly contract for maintenance on our recorders from all our 911 lines and all our radio transmissions for the law enforcement and the fire and EMS agencies that we dispatch.
Questions for Matt on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. And the last one, resolution authorizing the chair to sign an extension of a lease agreement with St. Lawrence Lewis BOCES for an emergency services communication tower on White Hill property in the town of Parrishville. Mr. Perkins and Ms. Curran. Go ahead, Matt.
What this is there was a resolution for the first 5 years. This is kind of an extension to it. We lease the property right now from St. Lawrence Lewis County BOCES that our tower on White Hill is at. This will expire in 5 years. We can go for another one, or the BOCES can do a referendum for us to take over the property. So this is asking for a resolution for an extension so we can work that stuff out for the next 5 years. Hopefully we can have a referendum done in the next year where it will be turned over to the county.
Great. Questions for Matt on this resolution? There being none, all those in favor? Aye. Opposed? Carried.
Thanks, guys.
Thank you, Matt. And next on the agenda is District Attorney Gary Pasco. Gary, are you with us? There you are. We have a resolution granting authorization to accept a donation of a vehicle from the city of Ogdensburg for the office of the District Attorney. So we'll move this resolution. Mr. Arquette and Ms. Curran. Go ahead, Gary.
Thank you. Good evening, everyone. So earlier this year, I had a investigator retire. We brought on a new investigator. At that time, I had discussions with the county about the vehicle the investigator was using. It's getting near its end of life. Luckily, Ogdensburg was getting rid of the vehicle that my new investigator used when he was employed there. It comes equipped with lights and sirens, which I think is necessary given his status as a police officer. And they were kind enough to donate that to the county at no expense. And it's got about half the amount of mileage the car he presently uses does. So it was a great gift and a generous offer from them that we will certainly put to good use.
Thank you. Does anyone have any questions or comments for the District Attorney on this resolution?
To the city.
There being none, all those in favor?
Aye.
All opposed? Carried.
Thank you.
Thanks, Gary. Next on the agenda, planning. We have a resolution authorizing the chair to sign a contract with the ARC Jefferson St. Louis for the operation of the public transit system for St. Lawrence County. Mr. Akers and Mr. Sheridan. Go ahead, Jason.
Thank you. Good evening, all. This resolution is to sign a contract with the ARC Jefferson St. Lawrence. They have been our provider since 2013. They're the only respondent to our RFP process, and we would like to proceed with having them continue on as our provider for the bus system. And this resolution authorizes the chair to sign the contract.
Questions on the resolution? Jason, I do have one we talked about in pre-committee regarding ridership.
Yes. Yes, thank you, Mr. Denisha. I know that data was submitted or put out on Google Drive, and I'm happy to bring it up here. If you would like to look at it in detail, I can summarize it relatively quickly. That since COVID, we have seen a reduction in ridership by about a third. So we're looking at 62–64% of our pre-COVID ridership on our routes. That I think is just the situation that we're in now, that fewer people are riding the bus, and we do certainly hope to bring those ridership numbers back up. We probably will see another reduction though as the students depart. They're heavy riders on 3 routes, and when the universities and the colleges close down at Thanksgiving, then those numbers we're anticipating will drop to about 50% of previous ridership numbers. So happy to go into more detail if there are any specific questions.
Yeah, I think Legislator Haggard has a question.
Yes, ma'am.
Thank you, Mr. Chair. Jason, do all the buses have cameras?
I'm afraid I don't know the answer to that, but I certainly can find that out for you.
Thank you.
Sure.
Anyone else have a question? There being none, all those in favor?
Aye.
Opposed? Carried. And Jason, just first the discussion on the lead grant, if you will.
Yes. Yep. Next on the agenda. Thank you. Yeah, we are making some progress. We do have additional individuals that are interested in the program and are going through the income verification process right now. We also have several projects. I know I mentioned one in the past that is over the allotted amount of or the allotted expenditure amount. And we have a couple more that we're getting more detailed cost write-ups on, and we'll be submitting to HUD to work through that process. That again, I mentioned we have an agreement in principle to go over our cap for the one project, and we're looking to do that for others as well. We have some great work out of public health with the advertising component of the program. They've seen a real uptick in Facebook posts and information that they're pushing out on Facebook about the program. So that's encouraging that more information is getting out there. We also, you may have noticed some buses that have some census advertisement on them. Of course, the census is complete now. We'll talk about that in just a minute. But we are able to, excuse me, pardon me, able to use the space on those buses, take off the vinyl advertising, replace that with other advertising, and we're looking to get some designs. Actually, we have some designs worked up that we're looking to take to public transit to get them installed on the buses, so we can get even more advertisement out there about the program.
Very good, thank you, Jason. Does anyone have any question regarding the lead grant? Okay, there being none, Jason, will move along to the Dank broadband survey. There were some questions that were asked in the last week, and you were going to follow up with them, so I'll turn it over to you.
Yes, thank you very much. I did put together a summary that I shared with Ruth, and Ruth has had it put up on the Google Drive, so I'll speak pretty much from that if you want to follow along. I was prepared just to go through it in some detail here, so but that's out there as well if you care to follow along. So last week there were some questions that resulted from the resolution that was brought forward from a previous presentation the week before by the Development Authority of the North Country. And the board asked the planning office to look into what inventory and survey data already exists to determine if the expenditure, the $38,250 that was in the resolution, essentially was necessary to obtain the broadband information for the county that was proposed. So first, just to give you a little, I guess, overview of how the planning office staff approached this request. We first looked at what information was going to be gathered by the inventory in the survey. So we went to Dank and asked them to give us a little bit more detail into what do you hope to get out of this. And then we sort of cross-reference that with what is existing, what is out there already on various sites, and look to see if there's some redundancies. And I think, in essence, I think that will hopefully answer the questions that were posed last week. Again, further research on our part, we determined that the 38,250 was broken down into two cost centers. The first was $27,250 for the specific inventory, which I'll speak about in a second, and then $11,000 for an online survey. So starting with the inventory, the inventory is proposed, Dank is proposing to work with a third party, ECC Technologies. They're out of Penfield, New York. And they will involve what they'll do is a visual inspection of pole infrastructure throughout the county. So it's the term that is used is ground truthing. They'll basically go out and they'll look on the infrastructure that exists in the county and determine what's up there. What is that a coax line? Is that a fiber line? What's actually out there? Now this information does exist in part. It exists on a couple sites. The information is on a FCC site and also on the New York State Residential Broadband Availability Mapper. Excuse me. That's a website that you can go to on the New York State Broadband site that basically you can zoom in to areas across the state and identify what service providers are there to allow for broadband connection. Now, where it gets a little tricky here is that the FCC site and the New York State site are not based on road segment information. They're based on census block group information, which can be pretty small. You can have just one road being a block group or one small area being a block group, but it's not quite as robust as block or road segment information, that block group information. So another example that was given to me about I guess just about the completeness of the data that's out there on those sites is that recently Verizon has upgraded connectivity in the Governor area, in parts of the Governor area, to FiOS. That's their high-speed access. And so that exists. We know that exists. But it is not on the New York State Broadband, not identified anyway on the New York State Broadband Mapper or on the FCC site. So I bring that up just to say that the data, there is data out there, but it is not as complete as what we know exists. So all that to say, this survey that is going to be carried out by the consultant, the ECC Technologies Group, will provide more detailed and more up-to-date data than is available now on the mappers. I'll move to the second component, the inventory component. That is a fixed cost of $22,000 in its totality. County would be responsible for $11,000, half of that. Excuse me. And that is, they call it a BAT campaign, which stands for Broadband Availability and Adoption Tool. And it's basically a survey process, but where it differs from, say, a regular survey or something that you might see through JCC, is that the data will also be incorporated with spatial analysis. So they'll use a lot of GIS to identify the results of the data. So it's a little more robust than just a standard survey that you would fill out and you get data results in an Excel type format or a database format. You actually, it'll go another step further to map those results. So those are the two components that that are being proposed for the cost. The initial cost identified again was $38,250. I did have several conversations with Dank officials just to say, okay, what data is actually going to be obtained here, and does it exist in other sources? Again, your question that you posed to us. And we identified that cell tower data is something that the county is in possession of, and that was identified as something that they would be looking for. So we were able to say, hey, we've got the cell tower data, we've got it in a GIS format already. It's been spatially analyzed. That was done by staff here in the planning office. There's also data out there from a provider. A provider has done an assessment, a sort of a road analysis assessment, like is being proposed here, for a portion of county road of the county road network. About 971 miles of the 3,994 miles of roads in the county have already been covered by this provider. That's about a 24% assessment percentage, I guess, that's already been done. So can we fold that into what is being proposed by this entity, and can we see a cost savings? And so we reworked the numbers. Dank got back with their consultant, said, hey, we've got this data that we can share. How will that affect the cost? So in its totality, the consultant came back with a $12,000 price reduction. Again, that's for the whole program. So having that, it would see a county reduction in cost of $6,000. So that would see a reduction from $38,250 down to $32,250 for what is being proposed by the Development Authority. So that's our research to date. I'm happy to answer any specific questions to the best of my ability here, and look for any input.
Yeah, Jason. Does anyone have any questions for Jason? Legislator Fay.
Yes, I'm looking at basically Dank's financial statements. I'm wondering why they're not paying for the whole shop themselves. With the millions of dollars between cash and investments they've got on hand, and if they're a public service corporation and the state doesn't want to fund them, why are we funding them? The job that I think that they should be doing.
Jason, do you want to answer that?
I don't know if I can. I certainly can't speak for Dank. So I think it would be just ingenuous for me to try to speak for Dank. I know the information that Mr. Fay presented last week shows that certainly there are Dank does have funds available. I know that in passing the conversations that I had, that the intent is a cost share here, because there will hopefully be direct benefits to St. Lawrence County as a result of this data. So I think that was maybe the thinking behind Dank, but again, I don't want to offer any speculation on that from Dank's perspective.
Okay, Jason, thank you. And I certainly didn't mean to put you on the spot. Question, because I know when we talked last week, we simply asked you to get some data for us. Legislator Reagan.
Jason, during last week's meeting, some of our colleagues raised the question. They said BOCES already has all this information available. Is that correct?
I was not able to find that specific data. I think if there are references made to what's on the New York State Broadband mapper, then that information, again, there's a lot of great information out there, again, by census block group, but I wasn't able to specifically track down the BOCES data that was referenced. I certainly can continue to look if that's the pleasure of the group.
Legislator Terminelli.
Thank you, Mr. Chairman. If I may provide some additional information in reference to the BOCES information. I reached out to Tom Burns over the week just to see if he was aware of that information being warehoused within the BOCES district. He did inform me that the state ed department does have a statewide survey that they have collected due to COVID, but it's definitely not as granular as the information that Dank can provide. But he also did say that school districts have addresses of students. So they do have address pockets as far as what the survey will also gather that Dank has put out there. I went on Lewis County's survey that Dank has out just to see what the survey was like, and it does just ask you to put in your address, to which I wondered if people don't have service, how they access the online survey. So I find that I did find that a little ironic. But so this do have that information, but Mr. Burns did say that it would not be as granular as what Dank could probably provide. And he did also say that the BOCES has partnered with Dank in the past and found them to be very reputable in their partnerships. So there's the information that I was able to collect through him.
Okay, thank you. Do you have something else you wanted to say, Maria?
One of the questions I thought that we asked Jason to come back with was the recommendation on whether or not he thought that by partnering with Dank on this, that we could obtain information that currently is not available, and that in the future will help us get better service out in some of the rural areas that are not being served.
Okay. Again, I'm not going to put you on the spot on this one, Jason. I don't think if you think you have a clear recommendation, that would certainly be. I would invite you to share it. But if you don't have a clear recommendation, certainly don't expect you to put yourself out there.
Well, I guess my goal was to provide the information to you, to inform your decision. The board as obviously the policy and decision maker entity for the county. I think the information that we were able to glean shows that this information that is going to be provided by this group will be more clear, more detailed than the information that exists now. We are also able to, I guess, get a little bit of a cost savings. So that's, it's not a huge reduction, but $6,000 is something, certainly. So I'm struggling a little bit here because if you want me to give you a specific recommendation, I will. But I guess I would defer to you as the decision-making body to make that call.
I accept that, Jason.
Thank you.
Any other questions, comments for Jason?
Mr. Chairman, I would suggest that Jason look into the BOCES information that they have, and then depending on what information they have, may also give us some leverage to get the reduction of the cost down even more than what we've already accomplished. Does Jason think that there could be a substantial amount of information that we would need that we don't know that BOCES has, that we should know about before we make a decision on this matter?
Right. Before I put Jason on the spot on that one, I'm going to Legislator Terminelli has a comment. I think she answered that previously.
I just to clarify, so BOCES does not have the warehoused information from each of the individual school districts, but to Mr. Burns' understanding, the school districts do have addresses of students that they were not able to get accessibility for, that they either had to get what they're using now are like Kajits, which are kind of, they're like temporary Wi-Fi spots, or students that are accessing areas like parking lots and things like that to have access to Wi-Fi. So it would be school districts that you'd get that information from. It wasn't warehoused by our local BOCES. State Ed Department does have a statewide survey that they collected that information in. I don't know the channels that you would go through to get access to that through State Ed.
Legislator Akers.
Where do we leave this resolution? Is it tabled to this meeting or is it tabled to the board meeting?
The resolution was not tabled to this meeting. It was tabled to I believe, the full board meeting. And we had asked Jason to put some information together for us, which he has done. And it would be, if I may, it would be my recommendation that Jason has provided the information that we asked him to provide. We digest it. If we seek any more, we can, I would say, try to delve into it. But next time we will deal with this particular issue is at the full board meeting when hopefully the resolution is brought off the table.
Thank you, Mr. Chairman. So just to define the issue, it's not about whether the service is needed. It's about what actually is out there and if Dank is willing to pay for it. So I think this board will have to decide. Obviously, we've got an offer of maybe $6,000 less, which means that they're not willing to pay for the whole thing. So it'll be up to our decision at the full board meeting whether or not this legislative body would be interested in actually fronting the remaining $32,000 or whatever, which for the record I'll be in favor of.
Correct. Yes. Legislator Hagley.
The purpose of the information from Dank was for us to be more specific when we applied for grants in order to provide our citizens more broadband. Is that correct?
That is the purpose of the survey, yes.
So I don't know that Jason can answer this or not, but are you familiar with these types of grants and the information that we have already? Is that sufficient, or do we need this? And I'm going to steal Legislator Terminelli's granular information. Do we need that for these applications, or are you familiar enough with what we do need those?
I have not been involved with specific grant writing for these funding sources. I know a couple that were identified in the proposal: the USDA Rural Development Broadband Reconnect Program, and there was another identified, the FCC Connect America Fund, that have not that we have not. Our office, in my experience anyway, has not written, so I couldn't say for sure exactly the detail. I know from other grant work that we do, more is usually better, right? If you have more specific data, if you want to focus in on one particular area that says, you know, this part of the southwest or the northeast part of the county has deficiencies in broadband accessibility, here is the information that shows it. And some of it is certainly, some of it will come from the New York State broadband data set. Some of it will come from the FCC data set, which are pretty synonymous. I think the New York State's probably a little more robust than FCC. But I guess to answer your question more in general terms, I guess is the best as I can, more detailed data that you have really makes a stronger application in most instances. I don't know specifically about these particular grants because I haven't been directly involved with them, but in most cases that is helpful. More data is usually better.
Mr. Perkins.
Thank you, Mr. Chairman. Seems to me that in the past, when we had the Time Warner at the time, Slick, and I think there was an Arkansas company that had presented to us and showing I think it was the census blocks or whatever, the areas that they own, and they were looking for grants because they have certain areas and they wanted to expand, but only if they get the grants. I don't think the county's gonna be getting the grants because we're not in the business of putting in fiber or internet or anything like that. So I think it's more for these private companies, Verizon or whoever it may be, for their benefit, or even potentially Dank, because I think they do some of that. But that's just my opinion.
Is there any other comments, questions regarding Mr. Fay?
One of the things that I think we gotta do as legislators, we gotta establish priorities. And after we get our priorities established, we gotta decide if we're gonna spend discretionary money. And basically, when I looked at this resolution a week or two ago, I said to myself, if this is a revenue source for Dank, and they got very good financial statements from what I looked at from March of 2019, I'm saying, if it's a revenue source for Dank, why is not Dank paying for the entire survey? And basically, I think as a public service corporation, or whatever officially they call it, basically, when I looked at their cash and their investments they had on hand, I couldn't answer that question. Why are they asking us to? And that's the question I'd like answered, to find out basically, if it is a revenue source for them, why aren't they paying for it?
Mr. Denise, if I could respond, I know that there was that question, and I did have conversations with Dank officials about, do they see revenue from this, and first of all, I guess the cost will be paid to the consultant, so that it's to cover the expense of the assessment. And I guess it was described to me as the providers, that the last mile providers are only going to come if there is a backbone that they can attach to, basically. And so getting that initial backbone, whether that be fiber or Dank has built out a fiber network, so presumably it would be a fiber network, that allowing that backbone to exist, or creating that backbone, will allow the providers to come forward and receive other funds when they become available from the state, like other providers in the county already have received some funds from the state to build out that sort of that last mile. So I don't, from my discussions with Dank, it doesn't look as if this is a specific revenue generator opportunity for Dank. But again, I don't want to get too far down the road of advocating for Dank, because I am not Dank. We work for you in the planning office. So, but I just want to share with you the conversation that I did have, that conversation about what is in it for Dank through this whole process, and what was shared with me is that they're not going to make money off of this.
Thank you, Jason.
You're welcome.
Unless there's someone that hasn't already spoken on this, I'm going to move on. You've already spoken, Mr. Akers, but.
Go after you then. I just wanted to, if I may, ask, last year Dank did some cost sharing, I think on I can't remember, Ruth could probably answer, on some equipment for the highway, which it was quite a bit of money.
Yes, it was. Ruth, are you still with us?
Of course.
Do you have the figure on the amount of money that when we bought some of the new equipment for solid waste that Dank helped us out with?
Yes, that total, the cost share was, the total that Dank put in was 700,000. We split it over 2 years.
Very good. Good. Very good. Thank you, Ruth. Legislator Smithers.
I think it's pretty much definite that there's a need for broadband, especially in recognition of the COVID going on and the need for remote learning and looking at our county. And there's a lot of areas that don't have service. They're quite remote. So the question then comes down to whether we want to spend the money, $22,000. I think it's well worth it. There's definite need there, so I'm going to be in favor of supporting it.
Very good. Thank you. Moving on. Legislator Burke, you are up with the, and I'm sure with the assistance of Jason and John, a discussion on the complete count summary for the census.
Yes, just to give a little perspective on the effort that went into the census, the local effort. It started in 2018 by updating the census addresses. There was an intern that developed maps and housing unit reports for 33 counties in St. Lawrence County, and an additional 20 communities in Franklin County. 2018, our planning department worked with Census Bureau geographic staff to ensure that town, village boundaries were accurate. And then into further into 2019, they, in December of 2019, declared an interest in New York State regarding the Complete Census Outreach Grant. From that point on, there was certainly a period of time where COVID interrupted our work and certainly the work of the outreach folks from the census. But early on, our department, John Tenenbush and Jason, were able to engage partnerships from 16 different entities, the universities, CDP, and so forth, which was very, very helpful in getting the word out. And just to maybe to skip to the conclusion of this, we're not going to know. We're not going to know the results until next March. At least that's what we're told. But there was a tremendous amount of effort put in from John Tenenbush and Jason, and rather than me speak to it, I would like to have one of them talk about all of the effort that went into it and the people they were able to engage to help with this. And my sincere gratitude to all of our partners, and in particular John Tenenbush and Jason. So if you wouldn't mind, Jason, filling in the gaps here.
Thank you, Mr. Burke. Yes, happy to talk further about the census here, but I have my friend and colleague on, John Tenenbush, who is known really famously as the census sensei. He has been involved with multiple censi, I guess, at least 3 that I'm aware of, and he is our go-to guy when there is ever any need for census information, and there is always a need for census information. We use it on a daily basis for everything that we do, any type of analysis that we do, any grant that we write it starts with census data. So it's very important to have this, and it only happens every 10 years. It's something that is unique in that regard. It's not like we have new data all the time. 10 years is when you get sort of a refresh on your data set, and of course it's projected and extrapolated through those 10 years. But really the decennial census is sort of the starting point of what kind of data you have. So maybe I'll just, John's here for a couple of reasons, certainly to fact check everything I say, and I'll maybe just start with what I think we've done, or what has been done through the Complete Count Committee, which with Legislator Burke has been the chair of, and then just wrap up with going forward, which John sort of summarized everything nicely. We did the census. Things were a little crazy as a result of COVID, and we got through it. We got the data that we hopefully, the best data that we hopefully could get, and then we'll see the results come December, March, April of 2021. So just a couple points I will point out with regard to the Complete Count Committee. That's something that John Burke, again, was the chair of, John Tenbush put together, really getting partners from around the county. The universities were big partners. The volunteer or League of Women Voters, CDP program, North Country Library System, DSS, the Akwesasne Mohawk tribe. All big players here, and we're all partners in the whole process. We were able to partner with New York State. They provided funding for census outreach, not as much as it was originally planned for in the pre-COVID days. In March of 2020, we had anticipated hiring 3 new staff to go out and really get the word out about the census. COVID hit, everything went dark with the state till August, really. We didn't know if we were going to get any funding from them. They did come through with half of the original funding, which was $127,556. I think we used that almost every last penny. We're just sort of calculating that out now. And to get the word out about the census and to get people engaged, to understand that the census is not a threat. It's an opportunity to provide information about where we live that is going to be beneficial going forward. So again, we spent the money. The good thing about this grant, unheard of with state grants, a 90% advance. We actually had the money in hand. We didn't have to get reimbursed for it. So that's always a good thing when you don't have to go to the county to act as a bank. You have the money in hand from the state. And we're looking to get the last 10% back, and we'll submit paperwork to recoup that expense in the next few months. But I don't want to go into any more specific detail. I will look to John Tenbush. John, if you want to add anything further on census process. I only hope I can convince you to stay for another 10 years so we can do it all over again in
No way.
2030.
No way. No way. Sorry. Now, I've done 3 censuses, and that's plenty. As John and Jason mentioned, the census this year was, completely in disarray because of COVID. We should have been doing in-person presentations to every garden club and town organization. across the county so that they would be the ambassadors for the census in their own communities. And of course, with COVID, we weren't able to do that. We also, in censuses in the past, we've gotten significant financial assistance or material assistance from the federal government. And this year we didn't get anything from the federal government in terms, well, we got very little from the federal government in terms of informational materials, handouts. It's amazing to me the utility of census pencils or notepads or water bottles or stuff like that. If you're in advertising, which I'm not, but this is my third census, so I've talked to plenty of people who talk about that. The important thing is to get the concept, to get the word out in front of people. So something as humble as a pencil, every time I pick up that pencil, if it says the census, it imprints again on my brain that the census is here, the census is coming. We didn't get any of that from the federal government this year, but it came from New York State. And it came from New York State very late. We didn't get any of those materials until the end of August. And then we had until the end of September to distribute the vast majority of it. And that's where our partners came in. They were heaven sent. The League of Women Voters, the People's Project, they alerted us to school distributions, food distributions, and other events where people were coming to get assistance. And we made sure that at a minimum, we got census information put into every bag or box that got distributed. And in most instances, we also got a tote bag or a water bottle or a pen or something like that, again, so that when people went home and they emptied their bag and this was everything that they needed, they had something from the census, another reminder from the census. We were able to, you'll see that one of our partners was the North Country Association for the Visually Impaired. Wow, how many blind people do we have in St. Lawrence County? Turns out a fair amount. But the other value that these folks had was they were already doing a radio advertising campaign for the census for Franklin and Clinton counties. So we were able to take some of the money that we got from New York State and pump it right into a radio promotion that Jason and I don't know anything about the radio, except you turn it on and listen to it. They knew the people to talk to. They knew what kind of rates to get. They knew what kind of coverage that different radio stations would get, and they were willing to help to work with us on that. WPBS is not on the list, but the CDP, the Community Development Program, worked with us to get spots on WPBS. And frankly, I don't watch WPBS, so I didn't realize how many people do. But from those television spots, I got a bunch of comments from people. I saw that on WPBS. Okay, fine. That's exactly what we're looking for. So you see the partner agencies that were included. They helped us just immensely. Jason and I would have been sitting here drowning in census crap if all of these partner agencies hadn't been there. The League of Women Voters, they did interviews with us that they put on the web. We had, I'm not going to embarrass him by naming him, but one of the volunteers for the League of Women Voters used to show up in our office about weekly and grab whatever we had, whether it was flyers or posters or knickknacks or whatever, and disappear. And the next thing we'd know, he'd tell us, I dropped a bunch of stuff off in Clifton and Fine. Or I was in Pierpont and I dropped a bunch of stuff off in Pierpont. This was the kind of coverage that we absolutely could not provide. And it was because of the kindness of strangers, as it were, that we were able to get all that stuff distributed. So that's more than enough for me to say, but I'm willing to answer any questions that anybody has.
So anyone have any questions for John or Jason regarding the census? Mr. Lightfoot.
John, what kind of success did you have with the Amish?
That's a very difficult question to answer. We didn't have much success with the Amish directly. So indirectly, we tried to target the Amish population by wrapping the buses. We had 3 buses in a van, and we put census advertisements on the outside of 3 buses in a van on routes that go through Amish country. We know that the Amish use the bus system a fair amount. We also made sure that we had newspaper ads. Now, we only put them in North Country this week. The Census Bureau already had an agreement with the Watertown Times. So we made sure that they were in locally produced, locally available free newspapers. And the Amish do look at North Country this week. We also made sure that we sent out a postcard to every single one of 51,000 residential addresses in the county. So that made sure that Amish families, Amish households would get a postcard to remind them about the census. 10 years ago, when we didn't have COVID, we mounted an effort to meet with the various bishops, the people in charge of different Amish congregations. And once we had more or less the consent of the bishops acted as our ambassadors to the Amish. Now, the Census Bureau told us that they were in touch with the bishops this year, and that's good because we were not, because of COVID, we were not in a position to do that. So hopefully we backed up the census's direct efforts with our indirect efforts.
If I may.
Go right ahead.
Were the Amish supplied with the mailings that the rest of us were that came early on in this effort? With either the possibility of, and I know they don't use computers, but being able to fill something out and mail it back in?
Yes, in June and July, the Census Bureau went to, theoretically, to every address that they had in their master address file for which they had not received a response by phone or by the computer. And they left a paper copy. So the Amish, an Amish household wouldn't have had that paper copy in March or April. But by July 15th, I think, the Census Bureau tells us that every household, which presumably means every Amish household as well, received a paper copy. Every household that had not responded received a paper copy. And I got plenty of phone calls saying, I filled out my census in March and I got a census form. Do I do it again? No. If you did it, you did it. But the paper copies were distributed.
Thank you, John. Great job as usual, and I expect nothing less after you've done it so many times. So, thank you.
You're welcome.
Anyone else have any comments or questions? Good job, John, as always. I like Jason's idea. Maybe you can stick around for another 10 years and you've got it down. So.
Well, it was a total team effort, and we have lots of young staff here in the planning office. So I will look forward to getting my census form in the mail 10 years from now. But thank you.
All right. Thank you very much. Okay, now we are on to Bruce.
Before the vacancy summary this month, that's the item I'll start with. We have 7 requests that were made of the Vacancy Review Committee out of 3 departments, and you'll hear 2 of those this evening and 1 next week at services. There are 2 abolishing creates, there's 1 create, and then there are 4 fill of existing positions. That being said, just a rundown of the last 3 months or the first quarter of the year. If you recall, I give the annual summary in August. We've seen 32 positions so far. 22 of those have been immediate fills, which is just under 70%. 7 held 30 days, 1 held 60 days, and 2 held 90 days. And for the most part, what we've been also trying to do as a reminder is make sure that if those positions have remained vacant, that departments get credit for that in the fill. So if by the time the board will approve, 90 days will have passed, we will capture that. But if in fact it's less or there's an immediate request, the Vacancy Review Committee has been very supportive of pushing those forward, as you'll see in the vacancies coming right up. So if there's no questions for me, we'll move on to the sheriff, who has a couple of requests for you this evening.
Thank you. So the first one is to fill a corrections officer position. Minimum staffing is 56. I have a CO that's retiring, and that would bring me down to 55. So I'm looking to fill this position to maintain the minimum staffing, which is set by the New York State Commission on Corrections.
Questions for the sheriff on this vacancy?
So the second one's a little trickier. It's, if you remember back in the beginning of the year, I came to you and made a civil position into a deputy's position, and I decided to be back to make the whole civil division deputies. So we have a civil officer that's retiring in January. Obviously, we need to abolish and create from a civil officer position to a deputy position. And the advantages are efficiency and flexibility with that officer. Obviously, some of our civil officers now go into dangerous places where they have to serve papers. Some are with drug issues. It's a dangerous environment out there. And we'd like those individuals armed for their protection and the protection of the public. They can also, are twofold. They can not only handle civil issues, but they'll be able to handle criminal assignments. If we get a biggest incident, i.e. the kidnapping we had years ago, I can take those officers out of the civil division and use them on road patrol. So the issue I'm having is the civil officer is retiring in January, beginning of January, due to the new contract. They're under the jail contract. There was a stipulation in the contract that if they retired in 2021, they got a $5,000 bonus. So they're going to take advantage of this contract, which means they're going to leave in January. The problem I'm having is to fill this position as a deputy sheriff position. The academy starts in the beginning of January. In the hiring process, i.e. through the Police Reform Act, you really want to do your due diligence and vet that person, do good background checks and civil service procedures, causes it to be about a 2-month process to get someone hired. Hence, I need to get someone hired in front of it instead of in back of it. So I'm looking to fill this position sooner than later and have that person ready to go in the beginning of January. I can't wait until to come to you folks in January because I can get the position filled prior to that. So it's kind of, we did this before, putting the cart before the horse, but when there's no plus or minus in any position, it's just making it where I can start going through the civil service process to hire this person so they're ready to go to the academy. It starts in January 11th.
Any questions or comments for the sheriff on this position, either one of the positions?
Mr. Chair, if there's no questions, we can move on to emergency services. We have one for the board to consider this evening.
Good evening, everybody. Good to see you again. The position I have in front of you is our supervisor of dispatch operations. The individual holding this position currently is going to retire at the end of this year. His last day in office is December 4th. His date of retirement is the 26th of December. He brings a lot to the table. There's a lot of specialty with a lot of different entities we have in our office. It's going to be very difficult to fill. It's a provisional on a civil service test, passing and getting in the top 3. I'd like to get this advertised and get it out so we don't have much of a vacant time between when he leaves and we can get somebody in that seat to get some training going on for him.
Questions?
Are there any questions?
Thank
we
you.
have none here, Ruth.
Okay. And I'll continue on if you'd like, right into County Administrator's report this evening. I will tell you that getting adjusted to this alternative environment is a little different. So I have some newfound sympathy for you out in the legislative world, listening and trying to follow along as well. So pardon my adjustment if I'm getting used to this. I do think, though, that it's an appropriate measure, considering the numbers that you heard tonight from Dana and from Dr. Williams. Certainly of great concern. going forward. I think spreading out the administrative team, certainly we've had the department heads participating for some months now that way, and I believe it's been successful. It's kind of funny when a legislator calls out and all of a sudden the picture appears and there you've got the expertise that we're looking for on any matter in county government. So I'm very grateful to everyone for making time in their schedule and getting used to this way of communicating. Talked a little bit about the state of emergency. Again, wanting to focus on the dramatic rise in cases. That's really the attention getter here. I'm going to be issuing a press release with the executive or with the emergency declaration later tonight. Certainly we'll copy all of you on it so you have that in hand should you get questions. At this point, I think hearing from both our public health experts, I think the interest is in trying to get a handle on these cases coming in. I think last week as we started to see them coming in a dozen at a time, and then the weekend just increasing dramatically, following then up with anticipations of the Halloween weekend impacting later this week, and then those 2-week rolls right into each set of our biggest holidays potentially of the year. So those types of conversations we're having with some frequency and trying to make sure that, you know, we understand the fatigue, we understand the challenges, but trying to make sure that people are aware and take necessary precautions. But I would mention there are no restrictions to travel. Most of you may be familiar with the declaration of a state of emergency in storm events. Besides COVID-19, that's typically when we would use it. So that would allow the sheriff in certain situations to make restrictions. None of those are in place at this time, nor does this declaration change any of the current status of the schools. So I think the schools have been doing a tremendous job. We met with the superintendents today. They are reviewing information every day, making their best effort to keep each district safe. And when it means a couple days, or in some cases a couple of weeks, closing their doors, going over to that remote setting, we believe their efforts are diligent to review each scenario. And as these timelines expand relative to making those contacts, getting those case investigations going, we believe they're doing their very best to keep folks attached to the education environment in a healthy and safe manner. So I greatly appreciated their time today. Also wanted to mention to you this Friday, if you recall back in May, Dana and Joe and I visited the Amish bishops and had a conversation about precautions that the Amish could take, informing them of what we knew at the time about COVID-19, and also trying to call their attention to the importance of taking precautions. We then visited again on October 20th with a family, trying to get some information out and make sure as best we can that compliance is in place for that population of folks, because they don't necessarily see all of the media that we put out about the precautions we need to take with COVID-19. And we'll be going again this Friday, the 13th, at 1 p.m. to meet with the bishops once again. I think we have an understanding of both communities in our county on the large part over towards Oswegatchie and then over in the Brazier area are being impacted by this, or the potential of being impacted by this. So better information, allow them to ask questions, and really pass along as much information as we can and open that door to keep communication open with the Amish is very important. Questions on that at this point? Okay. In honor of Veterans Day, we will be closed this Wednesday, just as a reminder for the office staff. I did just want to take a moment and commend the sheriff and his team. He ran through the dates for you, but for the immediate response to Executive Order 203, his professional approach, including many of the voices in the county to share in the outcome of police reform in St. Lawrence County is important. You know, the order was issued on June 12th. He was before you on July 13th. They got their accreditation in place by September 3rd. In October, he held those meetings with the public. And here he is on November 9th before you with a summation of all those activities. So I certainly appreciate, you know, the commendation from legislators about the hard work put into place, and hopefully complete that process by the end of December, emphasizing the importance of addressing these issues and making sure that there's a plan in place going forward. So thank you to the sheriff and certainly all the members of his team. Certainly takes a village. I did want to mention to you that the adopted budget documents are in production. For those of you who haven't gotten those, they will look eerily similar to the tentative documents without changes, although we do put out the adopted budgets. If you do want to return, and some legislators have in the past, your tentative documents. We'll do our best to recycle the pieces we can, which ends up helping save us some cost with the cost of production. But we will get those out to you within the coming weeks and make sure that you've got adopted budget prints. We will also, in keeping with county law, be advertising the adopted budget 2 times within 20 days of adoption. So you'll be seeing those out in our media as well. The new director hired by the Historical Association, her name's Ashley Moretti. I met with her last Thursday, and she's eager to get up to speed. She's relocated to St. Lawrence County, and she may be able to join us by Zoom briefly at Finance to introduce herself and to talk about some of the progress that they're already making. And I did want to mention that I've worked this last weekend with our interim historian. As you'll recall, we've separated out those roles. With Nancy LaFavor and attended the annual historians meeting. And they are talking about bringing forward a request to the board to designate a history month for St. Lawrence County. So that's not something that we have done before, but we are very interested in having the conversation with the board and bringing forward some information so that if we were able to designate for 2021, it would be later in the year, that would allow the historians in the local municipalities set up events, certainly COVID sensitive events. At that time, I'm hopeful we'll be able to celebrate the history of all of our communities in St. Lawrence County. I wanted to get to 2 staffing level conversations with you this evening. The first, I think we touched on a little bit with one of Legislator Haggard's questions earlier in the meeting. I wanted to ask about both feedback and any objections with regard to our cases. You heard the challenges that the public health department's having with case investigations. Now that's a little bit different than the contact tracing. And it seems at this point in time, our contact tracing is okay. The bigger concern is getting those case investigators on board. So what I would request is that the board grant me authorization expanded upon that part-time hiring ability, but to work with HR to get some case investigator type role established and be able to bring some people in to work with and support public health. And I think in the training component that goes into all of this, I'm being trained right now as a contact tracer so that I can help out. But from the case investigation component, if possible, they have to train in smaller numbers. So perhaps up to 5 at a time to be able to get more horsepower dedicated to those case investigations. So I did want to talk about that with you and see if there's any interest or objection in my doing so going forward. Questions?
Yeah, go ahead, John.
Ruth, how the surge is upon us, and I guess and I certainly appreciate the challenge that that you face and our public health department faces. I guess I'm wondering, you know, and I sense that maybe Dana and Dr. Williams didn't want to go into it too much, but if a week from now we have 200 cases, you know, if there is exponential growth, as we've seen in other areas, are we ready for it? And how soon? I mean, I wholeheartely support whatever you need to address the COVID situations. That's my personal standpoint. But I guess I'd like to know, you know, has there been adequate preparation, and are we ready for any kind of exponential growth?
I think one of the areas that we found very helpful with the state, as you may recall, the state helped with one of their teams with the travelers when that became a component of one of the things we needed to address. And so we were able to transfer all of the travelers over to the state resources, and they were able to track those because what we have on hand was not helpful enough to get all of the work done on the travelers and all of our cases. So I think part of our resources includes the state, They also now are being additionally helpful in situations where we need some work or some unique situations addressed. So I think we have some great partners in our ability to respond, but I think all of the systems, all at least 5 of our 7 counties up here are seeing some dramatic increases. And I think if I have a little bit of expanded ability to bring folks in, that we could make those hires. The training piece is a challenge for us because they're also trying to do the work and respond. But I think those are certainly conversations that we're having and want to be prepared as best we can.
Thank you.
Sure. Other questions
Thank
about
you,
that?
Ruth. Yeah, I know we've got a couple of questions, but I'd like to, before I get lost on it, just a show of hands, do you see who's in support of giving Ruth the autonomy to hire the 4 folks that are needed? Looks like it's unanimous, Ruth.
Okay. There's no other questions on that one. As I mentioned, I had
I
2
think
others.
Legislator Smithers has a question.
No,
Okay,
I
sure.
was gonna, what you said,
Okay,
that to support that.
okay. Go ahead,
All set?
Ruth.
Okay. And then the second area that I wanted to address, certainly I think made its way out into the media today about the potential of a reduced staffing level and returning with some sensitivity to the caution we're being given by public health. I'd like to take a look at moving our county staff back to an in-office 50% remote or telework. And my interest is a little bit different than that of which was declared by the governor back earlier this year. I think at that time, it was an area that we hadn't explored before. And certainly at this point where we should be experts at remote work. And I think part of what we want to accomplish now is 100% of the job duties. Now, as we all know, the functions in county government don't provide the opportunity for everyone to work remotely, but where it's possible in the office setting, I would like to be able to identify 100% of the work getting done, but also alternate the staff so that we reduce the opportunity for exposure and also for transmission in folks coming and going from work every day. I think what we're trying to do is maintain the number we have of our 806 positions this year, but our 700 roughly and 50 employees. We're trying to maintain that number at 5 and not have any more cases among our staff, but also looking sensitively at not the if, but the when of the potential for quarantine of staff attached to a unit that may have someone who's having to deal with the impacts and diagnosis of COVID-19. So if we can mitigate that, if we can be proactive, and if we can do it in a way that continues to serve the public at the level we are now, and gets all of the work done, not just what we have to get done, I'd like to be able to move toward that by the end of this week. Questions?
I think we're good, Ruth.
I think I can see Mr. Burke has his hand up.
Mr. Burke, you have your...
I did, Larry. I did.
Go ahead.
Just a comment, Ruth. I think it's great that you did this. It doesn't just assure that the work gets done. It helps protect our staff.
That's right.
And importantly, it helps protect our public because our public frequents the same areas as our staff do in many cases. So when we relieve congestion, we are doing a number of good things, and I commend you for it, Ruth. I think it's wonderful.
Thank you. Also, I just wanted to mention that we will review this every 30 days. We'll watch those cases. Certainly, we talk with Dana on a daily basis, if not hourly, in some circumstances, to keep well aware of what our numbers are doing. Public health is putting this data out in front of us. And I think it's critical to support our county departments when they're putting this type of information out there about the risk, about the concern, and it is increased, that we respond in a way that supports the work that they're doing. We have some really talented staff who's helping our greatly fatigued public health staff, but this will also allow our public health staff some respite by working from home and being able to accomplish the tasks as if they were at their desk. We have the licenses in place for the most part so that the phones will ring right through. That prevents people's personal phone lines from being engaged. It's a protective way to have those conversations, but not miss a phone call if you're not right at your desk. certainly most, if not most of our communication, quite a bit of it anyway, happens by email. So certainly that happens without interruption. And I think being able to take the time when the staff are in the office to prioritize those tasks, but also be able to work in communication with one another over the phone and over email. So I'm optimistic that this will be helpful in keeping our number below 5 or at 5 and not seeing any other cases. But certainly if we do, I think we have been talking with our department staffs about how we will respond. We have in a couple of instances done an extra cleaning. If you recall, in the summertime with Highway, we shut it down, cleaned everything really well. But we've been fortunate that the impact of those who have been diagnosed have not been an immediate at work that day. So there's, I think, some benefit to that as well. Are there any other questions?
Margaret, go ahead.
Thank you, Mr. Chairman. Ruth, thank you very much for your update. I think everything you've planned is great. I had a question about the actual implementation. If we go to 50%, is it the department heads that decide which 50 are in the office and which 50 are at home? How is that implemented?
So that happens at the department level, and certainly it's a different conversation between, let's say, our veterans department with 2 folks and social services with over 200. And so some delegation happens to supervisors, and I think the conversation as it's occurred previously provided for, if there are designated tasks that happen on certain days that require an office presence, those certainly are addressed. But I think that they give some flexibility and have those conversations to make it work the best they can for either that unit or that department as a whole.
So you're expecting to have this implemented by the end of the week, and the county employees have Wednesday off. So
they do.
Okay, great. Thank you. Thank you very much.
Any other questions? On anything? That's all I have, Mr. Chair.
Okay, thank you, Ruth. We'll move on to committee reports. The first one is Ag Environmental Protection Board. We did meet on Thursday, October 1st. Really, it was again with Zoom. Didn't have a lot to discuss. I guess the big topic of the evening was the county resolution that we passed, urging folks not to use farmland for solar arrays and such. Next meeting is Thursday, December 3rd. Next one, Mr. Burke, alternative to incarceration board.
The Alternatives to Incarceration Board has not met.
All your staff.
And so there's nothing to report.
Okay, thank you, John. Emergency Medical Services Advisory Board, Lieutenant Curran.
We've not had an additional meeting since I last reported.
Okay, thank you. Environmental Management Council, Legislator Terminelli.
Thank you, Mr. Chair. I have to apologize. I missed the last meeting. I had a youth committee meeting for Youth Advisory Board immediately before. And by the time that I had logged in and checked the agenda, I found out that I had to request meeting access through the planning board or the planning department, which was closed by then. But Mr. Tenbush, we are keeping him very, very busy today. He was kind enough and generous enough to provide me with an update that I could provide to you. So I will just read over the notes that he sent to me. We did not have a speaker at the October meeting, but they had 2 months worth of committee reports to review because our September meeting, we had done the online, the watershed management plan review. The Conservation of Resources Committee supported the county's household hazardous waste collection that occurred in Canton on September 19th. They're also working on a project to promote giving reusable tableware as gifts and stocking stuffers for the holidays this year so that they can reduce reliance on single-use plastics. The Environment and Economy Committee is looking into the feasibility of a fish bypass study at several locations in St. Lawrence County. They're looking for, they have a couple technical experts in mind that they would like to come and speak at upcoming events. And then the Invasive Species Committee is working on the Emerald Ash Borer Task Force to manage the county's response to EAB. Also learning about several new invasive species that are of concern. The beech tree disease, the hemlock woolly, I'm not even going to pretend to pronounce this one, and then the tench fish. And then the Watershed Management Committee is working on the St. Lawrence River Watershed Revitalization Project to develop its reports and supporting materials so that they can best serve the needs of St. Lawrence County. And then in addition to that, on Friday afternoon at 3 o'clock, there was a memorial dedication, a tree and a plaque in memory of Mr. Andy Suter it took place at the Messina High School. He was a board member of at Messina Central School District from 1999 to 2011, but he was also a 19-year EMC committee member. And so Pat Whalen, another committee member, led the charge in getting this tree and a plaque secured in memory of Mr. Suter and his services to environmental awareness. That's it.
Thank you much.
My next meeting is on the 18th.
Okay, thank you much. I knew Andy, and I'm glad that there was something done for him. The Fire Advisory Board, we met on October 15th. And I may have shared some of this information before, but year to date, we're 3,081 fire departments who are dispatched through the Emergency Services Center. And tower work is proceeding very well. In Governor is 99% complete. Waddington is 75% complete. Hammond is complete, just waiting for cure time on the foundation. And our next meeting is going to be December 17th. Jury Board, Inter-County Legislative Committee.
Okay, so they have a number of resolutions that they passed. One was budgetary, asking for overdue payments to the counties in our area from the governor. They talked about the invasive species, the woolly, I believe it's algorithm, but it's supposed to be the next new problem, like, to the, so then they had 3 resolutions from 3 different counties asking for the change in towers, like what they can have in the Adirondack Park area, because how high you need the tower in order to carry the signal is outside of what they allow them to do. So they had 3 different resolutions on that, and they're kind of still talking about from county to county what COVID is doing. So I'm sure we'll have update that in December when we meet again.
Okay, thank you. Jury Board, Mr. Sheridan.
Jury Board has not met, Mr. Chairman.
Okay. And Planning Board, Mr. Fay.
Jason covered a number of things, public transportation, lead grants, and talked about solar, and we had some board members training at the last meeting, and our next meeting will be Thursday night as well.
Thank you. Do we have any old business to come before this committee? Do we have any new business to come before this committee? Oh, excuse me, I didn't see you.
No, it's for new. So I sent all the legislators a little email with some facts about this messenger RNA virus. We don't actually have any vaccines currently that are made this way. It's a different technology, cutting edge. You probably have read mostly about messenger RNA in cancer treatment and how they use it as a biologic for attacking tumors and stuff. So just so that you have the information, just a basic outline, as I get more concrete stuff, I'll send it to you. And the other thing I thought of is we're having problems doing contact tracing. Perhaps what we should have is in each district, have people that do the contact tracing in that district. It might be easier to know within your district the social groups and who's around who, because people are not being very forthcoming with where they've been and what they've done. And within a district, you may have people that are more aware of the social network.
Ruth, do we have need for executive session?
We do for litigation, personnel, and appointments.
Okay, thank you very much. The motion to go into executive session. Mr.
Yep,
Akers?
just give us a couple minutes to shut off the live link.
All those in favor? Aye.
Move we adjourn.
We are adjourned.